This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and the Grenadines to assess their capacity and provide technical assistance and training in response to readiness. Virtual meetings took place with senior health officials of the Ministries of Health to identify gaps, needs, and challenges requiring PAHO's technical cooperation. National plans in all areas of response were reviewed to assess potential public health measures. Over 20 webinars were hosted to engage young people, those living with NCDs, health professionals, and representatives of the hospitality industry. Videos, posters, flyers, and social media cards on key public health messages were produced and disseminated. Over 80 bulletins and situation updates on preparedness and response activities were produced and disseminated. High-level briefings were conducted for ministry officials, diplomatic community, media, and business groups. Countries and territories were introduced to the Go Data software for data capturing and analysis of the chain of transmission. They also received training on the mathematical modeling of COVID-19 cases. Entry protocols for the reopening of borders were reviewed and guidance provided to national health authorities. Infrastructure for case detection at points of entry was strengthened through the provision of equipment such as thermal imagers and IT tools for data collection at main airports. Countries were supported on readiness and response measures at ports of entry. A webinar on considerations for resuming non-essential travel in the Caribbean was organized. Government ministers participated. PAHO played a major role in the procurement of PCR machines, test kits, and accessories. Approximately 46,055 PCR kits, consumables, and other reagents have been procured. Laboratory capacity for PCR testing in Barbados and the Eastern Caribbean countries has increased from 2 in February to 7 at present. Many countries received training in methods of COVID-19 diagnostics. A webinar on scaling up laboratory testing in the Caribbean was successfully conducted. We facilitated infection prevention and control training sessions for over 750 health workers and personnel in the hospitality sector. Videos on the donning and doffing of personal protective equipment were produced. All countries were provided with personal protective equipment on an ongoing basis. Essential biomedical equipment was procured for countries. A webinar on the clinical management of COVID-19 focusing on experiences, challenges, and lessons learned was hosted. 187 persons participated. PAHO formed relationships with several international vendors to facilitate the procurement of medical supplies and equipment. The Barbados Defense Force and the Regional Security System of CARICOM are essential partners in the distribution of vital supplies and equipment. Personal protective equipment supplies are continually provided to member countries. A vaccination week in the Americas virtual campaign was held. Technical guidance, posters, and animated graphics containing key messages were provided. Consultations on school nutrition policy for Barbados was conducted. Anguilla was supported with a series of mental health and psychosocial support webinars. A Building Back Better Services webinar on non-communicable diseases was convened. St. Lucia was supported with the expansion of the HEARTS initiative to build back better NCD services. Overall, country preparedness, response, and coordination is enhanced. The spread of the virus is controlled. Health workers are protected by provision of training and essential supplies. capacity for testing, treatment, isolation, quarantine, and contact tracing enhanced. Countries are now able to open their borders, economy, workplaces, and schools safely. PAHO extends gratitude to international partners and governments for their financial support and collaboration. We are PAHO, and we care.
Es importante que lo hagamos, hay que colaborar, hay que tener empatía por las personas que de pronto están pasando por una situación difícil y que necesitan este recurso de la sangre.
This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and the Grenadines to assess their capacity and provide technical assistance and training in response to readiness. Virtual meetings took place with senior health officials of the Ministries of Health to identify gaps, needs, and challenges requiring PAHO's technical cooperation. National plans in all areas of response were reviewed to assess potential public health measures. Over 20 webinars were hosted to engage young people, those living with NCDs, health professionals, and representatives of the hospitality industry. Videos, posters, flyers, and social media cards on key public health messages were produced and disseminated. Over 80 bulletins and situation updates on preparedness and response activities were produced and disseminated. High-level briefings were conducted for ministry officials, diplomatic community, media, and business groups. Countries and territories were introduced to the Go Data software for data capturing and analysis of the chain of transmission. They also received training on the mathematical modeling of COVID-19 cases. Entry protocols for the reopening of borders were reviewed and guidance provided to national health authorities. Infrastructure for case detection at points of entry was strengthened through the provision of equipment such as thermal imagers and IT tools for data collection at main airports. Countries were supported on readiness and response measures at ports of entry. A webinar on considerations for resuming non-essential travel in the Caribbean was organized. Government ministers participated. PAHO played a major role in the procurement of PCR machines, test kits, and accessories. Approximately 46,055 PCR kits, consumables, and other reagents have been procured. Laboratory capacity for PCR testing in Barbados and the Eastern Caribbean countries has increased from 2 in February to 7 at present. Many countries received training in methods of COVID-19 diagnostics. A webinar on scaling up laboratory testing in the Caribbean was successfully conducted. We facilitated infection prevention and control training sessions for over 750 health workers and personnel in the hospitality sector. Videos on the donning and doffing of personal protective equipment were produced. All countries were provided with personal protective equipment on an ongoing basis. Essential biomedical equipment was procured for countries. A webinar on the clinical management of COVID-19 focusing on experiences, challenges, and lessons learned was hosted. 187 persons participated. PAHO formed relationships with several international vendors to facilitate the procurement of medical supplies and equipment. The Barbados Defense Force and the Regional Security System of CARICOM are essential partners in the distribution of vital supplies and equipment. Personal protective equipment supplies are continually provided to member countries. A Vaccination Week in the Americas virtual campaign was held. Technical guidance, posters, and animated graphics containing key messages were provided. Consultations on school nutrition policy for Barbados was conducted. Anguilla was supported with a series of mental health and psychosocial support webinars. A Building Back Better Services webinar on non-communicable diseases was convened. St. Lucia was supported with the expansion of the Hearts Initiative to build back better NCD services. Overall, country preparedness, response, and coordination is enhanced. The spread of the virus is controlled. Health workers are protected by provision of training and essential supplies. capacity for testing, treatment, isolation, quarantine, and contact tracing enhanced. Countries are now able to open their borders, economy, workplaces, and schools safely. PAHO extends gratitude to international partners and governments for their financial support and collaboration. We are PAHO, and we care.
Es importante que lo hagamos, hay que colaborar, hay que tener empatía por las personas que de pronto están pasando por una situación difícil y que necesitan este recurso de la sangre.
This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and the Grenadines to assess their capacity and provide technical assistance and training in response to readiness. Virtual meetings took place with senior health officials of the Ministries of Health to identify gaps, needs, and challenges requiring PAHO's technical cooperation. National plans in all areas of response were reviewed to assess potential public health measures. Over 20 webinars were hosted to engage young people, those living with NCDs, health professionals, and representatives of the hospitality industry. Videos, posters, flyers, and social media cards on key public health messages were produced and disseminated. Over 80 bulletins and situation updates on preparedness and response activities were produced and disseminated. High-level briefings were conducted for ministry officials, diplomatic community, media, and business groups. Countries and territories were introduced to the Go Data software for data capturing and analysis of the chain of transmission. They also received training on the mathematical modeling of COVID-19 cases. Entry protocols for the reopening of borders were reviewed and guidance provided to national health authorities. Infrastructure for case detection at points of entry was strengthened through the provision of equipment such as thermal imagers and IT tools for data collection at main airports. Countries were supported on readiness and response measures at ports of entry. A webinar on considerations for resuming non-essential travel in the Caribbean was organized. Government ministers participated. PAHO played a major role in the procurement of PCR machines, test kits, and accessories. Approximately 46,055 PCR kits, consumables, and other reagents have been procured. Laboratory capacity for PCR testing in Barbados and the Eastern Caribbean countries has increased from 2 in February to 7 at present. Many countries received training in methods of COVID-19 diagnostics. A webinar on scaling up laboratory testing in the Caribbean was successfully conducted. We facilitated infection prevention and control training sessions for over 750 health workers and personnel in the hospitality sector. Videos on the donning and doffing of personal protective equipment were produced. All countries were provided with personal protective equipment on an ongoing basis. Essential biomedical equipment was procured for countries. A webinar on the clinical management of COVID-19 focusing on experiences, challenges, and lessons learned was hosted. 187 persons participated. PAHO formed relationships with several international vendors to facilitate the procurement of medical supplies and equipment. The Barbados Defense Force and the Regional Security System of CARICOM are essential partners in the distribution of vital supplies and equipment. Personal protective equipment supplies are continually provided to member countries. A Vaccination Week in the Americas virtual campaign was held. Technical guidance, posters, and animated graphics containing key messages were
Las Américas enfrenta hoy una crisis de salud sin precedentes llamada COVID-19. Nuestro continente se ha convertido en el epicentro de esta nueva enfermedad altamente transmisible y la Organización Panamericana de la Salud continúa liderando, respondiendo, trabajando para rastrear, frenar, tratar y detener esta nueva enfermedad, desplegando asistencia, fortaleciendo los servicios de salud, asesorando a los gobiernos, apoyando la investigación en 52 países y territorios de las Américas. Por favor, acompáñanos en esta lucha. Trabajemos juntos, unidos, para detener la propagación de la COVID-19. Las Américas enfrenta hoy una crisis de salud sin precedentes llamada COVID-19. Nuestro continente se ha convertido en el epicentro de esta nueva enfermedad altamente transmisible y la Organización Panamericana de la Salud continúa liderando, respondiendo, trabajando para rastrear, frenar, tratar y detener esta nueva enfermedad, desplegando asistencia, fortaleciendo los servicios de salud, asesorando a los gobiernos, apoyando la investigación en 52 países y territorios de las Américas. Por favor, acompáñanos en esta lucha. Trabajemos juntos, unidos, para detener la propagación de la COVID-19.
Buenas tardes. Muy buenas tardes a todos. Damos inicio a la sesión de la tarde con el punto 3.3, elección de 3 magistrados miembros para integrar el comité ejecutivo por haber llegado a su término los mandatos de Belice, Canadá y Perú. Señalo a la atención del Consejo el documento CD 584 e informo que se recibieron las candidaturas de Brasil, Cuba y Surinam. Le concedo el uso de la palabra a la Secretaría para que presente el punto de informe sobre las disposiciones reglamentarias relacionadas con este punto. Adelante, la Secretaría, por favor.
Thank you, Mr. President. The Executive Committee, under the Constitution, is composed of 9 members of the organization, which are elected by the conference or the council for overlapping periods of 3 years. This year, it is incumbent upon the directing council to elect 3 members to replace Belize, Canada, and Peru, whose terms on the committee have expired. I also want to explain that although France, the Kingdom of the Netherlands, and the United Kingdom may participate in the voting, they are not eligible for membership of the on the executive committee under the Constitution of the organization and the rules of procedure. Associate members and observer states are not entitled to vote, nor may they be candidates for the executive committee. The only other countries not eligible for election this year are the 3 outgoing members of the executive committee. Again, Belize, Canada, and Peru, because every member leaving the committee must remain off the executive committee for at least 1 year before being eligible for re-election. And of course, the continuing members of the committee, that is Barbados, Costa Rica, Ecuador, Haiti, Mexico, and the United States of America are also not eligible for election. If the number of candidates does not exceed the number of vacancies, Rule 51 of the Rules of Procedure applies. Rule 51 states, elections shall normally be held by secret ballot, except as concerns the election of an ad interim director, when the number of candidates for elective office does not exceed the number of offices to be filled. No ballot shall be required, and such candidates shall be declared elective. Rule 57 states, the term of office of the members elected to the committee shall begin immediately after their election and shall continue until their successors are elected in accordance with Article 15, Paragraph A of the Constitution. Thank you, Mr. President. Back to you.
Muchas gracias a la Secretaría. Informa al Consejo que por haber solo 3 candidatos de conformidad con el artículo 51, Brasil, Cuba y Surinam son elegidos para ser parte del Comité Ejecutivo. Ahora le pido al relator que presente el proyecto de resolución que formaliza la decisión del Consejo. Adelante, señor relator.
Buenas tardes, señor presidente.
Creo.
Elección de
President, appointment of a member.
Relator.
Mr. Rapporteur says the President, United States is asking for the floor. United States, please go ahead.
Thank you very much, Mr. President. We thank the governments of Belize, Canada, and Peru for their service on the Executive Committee. With your leadership, we have accomplished enormous strides for transparency and accountability. However, we are concerned that the seating of Cuba on the Executive Committee this year could undermine those gains, as demonstrated by Cuba's inappropriate interventions raising political issues this morning. The United States categorically opposes Cuba's position on the executive committee based on the concerns shared by the US delegation at yesterday's meeting, which are worth repeating. The Cuban government faces allegations of human trafficking of medical workers for its own financial and political gain under a scheme disguised as humanitarian assistance that has put PAHO in a complicated situation. Cuba's alleged actions of trafficking its own people are unacceptable. Placing the Cuban government on PAHO's executive committee is offensive to the basic principles of an organization whose mandate is to promote and protect public health. With these concerns in mind, the United States government welcomes PAHO's decision to initiate an independent review of PAHO's role in the Mais Medicos project involving Cuban medical workers in Brazil. We call on member states and PAHO to closely monitor the actions of Cuba and protect the integrity of the external review. We further insist that Cuba report to PAHO on its recruitment and export of medical professionals and fully address the allegations of human trafficking to ensure transparency and accountability. We hope Cuba will rise to the occasion in focusing on the health issues of the Americas while serving on the executive committee. Thank you, Mr. President. Over.
Muchas gracias.
Thank you very much.
¿Alguien más pidió la palabra?
Are there any further requests for the floor? Suriname, you have the floor.
Surinam, adelante.
Suriname, you have the floor.
Surinam, no lo escuchamos.
Thank you, Mr. President. Suriname thanks the member states for providing Suriname the opportunity to serve as a member of the Executive Committee. We will do our utmost best to support this important advisory body of the PAHO in order to help secure PAHO's role and efforts in protecting and improving people's health in the region of the Americas. Thank you.
Cuba tiene la palabra.
Cuba is recognized. Thank you very much, Mr. President. It is unfortunate that the government of the United States, lacking international support, has attempted and brought these accusations that we have just heard. Cuba is a member of the PAHO's Council and has the right to be a member of its executive committee. To try and justify its illegal genocide policy, it has offered visas and money and other incentives to by false witness against the work of the Cuban medical brigades. It is lack of respect, is no moral to try to link trafficking in persons with the work of our medical workers who carry out their duties voluntarily and generally in places where other health services do not reach out. International medical cooperation by Cuba has been recognized and acknowledged in Cuba and throughout the world, and by WHO and the United Nations. The Mais Medicos Brazilian program allowed between 2013 and 2018 for the Cuban medical staff to take care of over 100 million patients, providing health coverage to 60 million Brazilians and improving health indicators. The campaign and attitude by the United States is despicable and deserves all international condemnation. Thank you very much. Thank you. We'll ask for a 5-minute break to the Council. We need to conduct some internal consultations. We shall be back in 5 minutes.
Bueno, muy buenas tardes. Continuamos con el
Good
punto.
afternoon again. Let us continue with agenda item 3.3. Given what we have heard from the United States to the nomination of Cuba, to the objection of Cuba's candidacy for the executive committee, I would like to ask Secretariat to once again read Articles 51 and 57 so that we are clear as to the procedure to be followed. Madam Secretary, if you would kindly read the two articles having to do specifically with this item. Thank you.
Thank you, Mr. President. Rule 51 states, elections shall normally be held by secret ballot, except as concerns the election of an ad interim director when the number of candidates for elective office does not exceed the number of offices to be filled. No ballot shall be required, and such candidates shall be declared elected. Rule 57 states, the term of office of the members elected to the committee shall begin immediately after their election and shall continue until their successors are elected in accordance with Article 15, Paragraph A of the Constitution. Thank you, and over to you, Mr. President.
Muchas gracias.
Thank you very much. Having heard Rule 51 in particular, if the three candidates cover the three vacancies, then there would be no need for an election, and they would automatically be elected as members of the executive committee. That is what we read in Rule 51. So, having heard that article read out to us, the candidacies of Brazil, Cuba, and Suriname would be directly incorporated and would be elected as members of the executive committee. Given the case of the objection by the United States, then obviously this objection will also be reflected in the minutes and in the terms stated by the United States when addressing the potential election of Cuba. I will ask the rapporteur to read the proposed resolution. Thank you, Mr. President. Agenda item 3.3 of the agenda, election of 3 member states to the Executive Committee on the expiration of the periods of office of Belize, Canada, and Peru. The 58th Directing Council, 1. Bearing in mind the provision of Articles 4.d and 15.a of the Constitution of the Pan American Health Organization. 2. Considering that Brazil, Cuba, and Suriname were elected to serve on the Executive Committee upon the expiration of the periods of office of Belize, Canada, and Peru, resolves 1. To declare Brazil, Cuba, and Suriname elected to membership on the Executive Committee for a period of 3 years. 2. To thank Belize, Canada, and Peru for the services rendered to the organization during the past 3 years by their delegates on the Executive Committee.
Muchas gracias, señor relator.
Thank you, Rapporteur. I then therefore declare the resolution adopted, whereby Brazil, Cuba, and Suriname are appointed as members to the Executive Committee of PAHO. So we have 9 members now, and these are Costa Rica, Haiti, Mexico, Barbados, United States, Brazil, Cuba, and Suriname. We move on to the next agenda item. Agenda item 6.1, election of 2 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information, BIREME. United States has asked for the floor. You have the floor, United States.
Thank you, Mr. President. We appreciate the opportunity to speak before the next agenda item very quickly. We just want to make the point that we wish to exercise our right of reply to call out Cuba's appalling and egregious use of words. Their reference to genocide is deeply offensive and dismissive to the victims of actual genocides that have occurred, and we would like to note this for the record.
Sí, señor, señora delegada, de acuerdo a su solicitud.
Thank you, Madam Delegate, and based on your request, your terms will be reflected in the minutes. Brazil is now asking for the floor. Thank you very much, Mr. President. I simply wanted to take this opportunity to thank the Directing Council for electing us, and in particular Argentina, thanking them for the support. Brazil will be fully available henceforth to move forward with the agenda of PAHO to promote health for all the countries in the region and cooperation in fighting COVID. Thank you very much, Mr. President. Thank you, Brazil. If there are no further requests for the floor, we move to agenda item 6.1, election of 2 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information, BIREME. I would like to bring document CD 5816 to the attention of the Council and ask the Secretary to present the item and report on the statutory provisions concerning this item. Secretary, please go ahead.
Thank you, Mr. President. The Latin American and Caribbean Center on Health Sciences Information, BIREME, is a specialized center of PAHO, established in 1967, with headquarters in Sao Paulo, Brazil. In accordance with BIREME's statute, Resolution CD 49.R5, the center's objective is to contribute to health development for the populations of the region of the Americas, promoting cooperation among countries, the democratization of access to scientific and technical information, legislation, and the sharing of knowledge and evidence to support steady improvement of the health, education, and research systems. In accordance with the governance structure established by its statute, BIREME consists of 3 permanent bodies: 1, an advisory committee; 2, a scientific committee; and 3, a secretariat. The advisory committee is composed of 2 permanent members, 1 appointed by the government of Brazil and 1 by the director of PAHO, and 5 non-permanent members selected and named by the conference or the directing council of PAHO from among BIREME membership described in Article 4 of the statute. According to Article 4 of the statute, selection of the 5 non-permanent members should take into consideration geographic representation and be rotated every 3 years. However, the conference or the directing council of PAHO may indicate a shorter rotation period in cases where it is necessary to maintain balance among the members of the advisory committee. This directing council is asked to elect 2 non-permanent members to serve on the BIREME Advisory Committee on the expiration of the periods of Barbados and El Salvador. Since the number of candidates does not exceed the number of vacancies Rule 51 of the Rules of Procedure of the Directing Council provides. Elections shall normally be held by secret ballot, except as concerns the election of the ad interim director, where the number of candidates for elective office does not exceed the number of offices to be filled. No ballot shall be required, and such candidates shall be declared elected. Thank you, Mr. President. Back to you.
A la Secretaría.
I thank the Secretary. There being only two candidates, and in accordance with Article 51, we declare Colombia and Costa Rica elected to be members of the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information. Colombia, I believe, is asking for the floor. Colombia, you have the floor. Thank you, Mr. President. We understand that the election has just taken place, and for Colombia, it is an honor to be part of this panel, and we'd like to thank you all for electing us. It's an honor to join the Latin American and Caribbean Center on Health Sciences Information, BIREME. My country will work towards the development of health through all scientific evidence, publications, etc. We also express our thanks to Barbados and El Salvador as outgoing members of the committee. Thank them for the work carried out in the past 3 years, which has ensured smooth operation of this mechanism. Colombia takes over today with great responsibility, committing to participate actively in the discussions in this committee, and will continue promoting the strengthening of information, investigation, research, and health issues in the countries of the region. Thank you very much, Mr. President, and thank you to all members. Thank you very much, Dr. Belmont. I'll ask the rapporteur to kindly read the proposed resolution, but before that, the United States is recognized. Please go ahead.
Thank you very much, Mr. President. Good afternoon. Para los Estados Unidos agradece a Barbados y El
The United States is thanks
por sus contribuciones o aportes por el trabajo que
Barbados and
durante los últimos.
The sound is, we're getting interruptions in the sound from the USA. Perhaps you need to mute original audio, USA.
Adelante, Estados Unidos.
Please go ahead, United States.
Perfect. Thank you very much. Los Estados Unidos
The United States thank Barbados and El Salvador
por sus aportes al
for their
trabajo
contributions
durante los últimos 3 años.
that they have conducted in the past 3 years.
Estamos muy entusiasmados con la nominación de
We are highly enthusiastic about the appointment of Colombia and Costa Rica as new members to serve on the advisory committee and all the contributions that we are sure they will share with us.
Los Estados Unidos aprecian
The
mucho
United States
para
values the
facilitar
work
acceso a
carried
información de
out
salud
by
confiable,
BIREME to facilitate access to
técnica,
reliable, technical, and scientific medical information
a través de sus proyectos como el
through projects
virtual.
such as the effect of virtual health.
Y realmente le agradecemos a la OPS
And we are truly grateful to PAHO
continua
for its
para promover
continuing
el acceso y el
dedication
uso
to promote
a información de
access
salud
and
científica y
use
veraz.
to scientific and truthful information.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Thank you, United States. There being no further requests for the floor, I would like to ask the rapporteur to kindly read the proposed resolution. Rapporteur, you have the floor. Thank you, Mr. President. Agenda item 6.1 of the agenda, election of 2 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information, BIREME. document CD 58/16. The 58th Directing Council, 1. Bearing in mind that Article 6 of the Statute of Bireme establishes that the Advisory Committee of Bireme is to be comprised of one representative appointed by the Director of PASB and one by the Government of Brazil as permanent members, and that 5 non-permanent members are to be selected and named by the Directing Council or the Pan-American Sanitary Conference of the Pan-American Health Organization from among the Bireme membership, which at this time includes all PAHO member states, participating states, and associated states, taking geographical representation into account. 2, recalling that Article 6 further states that the 5 non-permanent members of the Bireme Advisory Committee should be rotated every 3 years, and that the Directing Council or the Pan-American Sanitary Conference of PAHO may indicate a shorter rotation period in cases where it is necessary to maintain balance among members of the Advisory Committee. 3, considering that Colombia and Costa Rica were elected to serve on the Bireme Advisory Committee beginning 1 January 2021, due to the completion of the term of Barbados and El Salvador, resolves 1, to declare that Colombia and Costa Rica elected as non-permanent members of the Bireme Advisory Committee for a 3-year term, 2021-2023. 2, to thank Barbados and El Salvador for the services provided to the organization by their delegates on the Bireme Advisory Committee over the past 3 years. Thank you very much, Rapporteur. We offer the floor to the plenary for discussion of this resolution. There being no request for the floor, and there being no objection, this resolution is adopted. Thus, Colombia and Costa Rica have been elected to the Advisory Committee of the Latin American and Caribbean Center of Health Sciences with Mexico, Guyana, and Uruguay. Thank you very much. Let us move to the next agenda item, 5.6, amendments to the financial regulations and financial rules of the Pan American Health Organization. Let me clarify that the alternate text for this resolution was published last night as an addendum, and right now I would like to ask the rapporteur to present the new text. Mr. President? The President responded, yes, sir, we hear you. Agenda item 5.6 of the agenda, amendments to the financial regulations and financial rules of the Pan American Health Organization. Document 58/13. We will read the original text and then at the end, the amendment that has been made. The 58th Directing Council, having considered the recommendations of the Executive Committee and the amendments proposed to the financial regulations of the Pan American Health Organization that are in Annex A of the document, considering that the amendments to the financial rules would mean that it would be in accordance of IPSAS, specifically regards to the deterioration of values as they are counted, resolves approve the changes to the regulation of the Pan American Health Organization having to do with the deterioration of values in Annex A of document 58/13 and ensure that these modifications, the document that was circulated, Mr. President, has amendments, and we will read them right now. The 58th Directing Council, 1, having considered the recommendation of the Executive Committee and the amendments proposed to the regulations of PAHO that appears in Addendum 1 of the document of the Directing Council, document CD 5813, 2, considering that the amendments of the financial regulations would ensure that the organization is in accordance with IPSAS 29, specifically with regards to the deterioration of value so that they be accounting at a reasonable value, resolves approve the amendments to the financial regulations of the Pan American Health Organization having to do with the deterioration of the value of assets as provided in Addendum 1 of document CD 58/13 and ensure that these modifications enter into force immediately. Thank you very much, Rapporteur. We offer the floor to the plenary for discussion of this addendum. Apparently, there are no requests for the floor. We believe, therefore, that there are no objections, and I declare the resolution adopted. Thank you very much. Let us move on to the next agenda item 5.7. Update on the appointment of the external auditor of Pan American Health Organization for 2022-2023. I would like to bring document CD 58/14 to the attention of the Council and invite the representative of the Executive Committee to report on the item. The representative of the Executive Committee has the floor. Do we have the representative of the executive committee connected? Are they online? We're just confirming that, says Monica. If you could please once again mention the agenda item and to call upon them, please. Item 5.7, update on the appointment of the external auditor of Pan American Health Organization for 2022-2023. I would like to bring document CD 58/14 to the attention of the Council and invite the representative of the Executive Committee to report on the item. Well, since we don't have the representative connected, I suggest we move on to the next agenda item while we try and contact a member of the Executive Committee. Mr. President, says Monica, apparently they are now online. The connection has been re-established. So we're in touch with them. So we have the representative of the Executive Committee.
Good afternoon, President. During its 106th session in June, the Executive Committee considered a proposal to reappoint the current external auditor for the 2022 to 2023 biennium. The committee was informed that the practice in the past has been to extend the appointment of the external auditor for an additional biennium if the auditor has discharged its mandate satisfactorily and if the auditor is willing to serve for another biennium, both of which are true in the case of the current external auditor, the National Audit Office of Great Britain and Northern Ireland. Accordingly, the Bureau recommended that the National Audit Office should be reappointed for another biennium. In the committee's discussion of this matter, the high standard of excellence demonstrated by the National Audit Office was recognized and support was expressed for its reappointment. It was pointed out, however, that best practice among international organizations is to limit the appointment of the external auditor to a single term of 4 to 6 years that would not be immediately renewable. It was recommended that the governing bodies should consider amending PAHO's financial regulations to reflect such term limits. Thank you, Mr. President. This concludes my report on this item. And assess contributions would.
I thank the representative of the Executive Committee. I now give the floor to Mr. Gerald Anderson, Director of Administration, to present the item. Mr. Anderson, you have the floor.
Thank you very much, Mr. President. The document associated with the item explains that our practice has been in the past to extend the term of our external auditors up to a total of 6 years if they are willing and if the member states are satisfied with the work of the external auditor. And in this case, the Secretariat recommends that we follow that practice and extend the appointment of the National Audit Office of the United Kingdom of Great Britain and Northern Ireland for an additional term of 2 years. Thank you, Mr. President.
Thank you. I offer the floor to the plenary for discussion.
Ron.
It seems that there are no comments. Madam Director, do you have any comments?
Mr. President, only to thank the National Audit Office of the United Kingdom for their high standard of work to the organization, and again to reiterate our recommendation to reappoint them for 2 years. Thanks.
Thank you very much, Madam Director. The results of this debate will be included in the final report. Now we can go on to the next agenda item, which is 4.4, current financial situation and adjustments to the Pan American Health Organization's strategic priorities. I bring to your attention document CD 58/8, and I call on the representative of the Executive Committee to report on this item. Please go ahead, representative of the Executive Committee.
Ready? As I reported earlier, Mr. President, as I reported earlier, during its special session on May 29th, the Executive Committee examined a report on the financial crisis caused by non-payment of assessed contributions and considered several proposed measures for dealing with the situation. The Bureau described the measures that had already been taken to reduce costs and presented several proposals for further cost reductions, together with several borrowing options that would enable the organization to continue functioning until the end of the year. The Bureau also suggested that the committee should form a working group of member states to review the organization's strategic priorities and budget allocations for 2020 to 2021, bearing in mind that the delays in receipt of assessed contributions would most likely make it impossible to fulfill those priorities. The committee authorized the director to borrow up to $15 million from the Master Capital Investment Fund in order to finance expenses under the program budget for 2020 to 2021 and to implement a temporary staff furlough scheme as a cost-saving measure. The committee rejected a proposal to authorize the director to engage in external borrowing from the commercial market. The committee also agreed to establish the member state working group, which will be presenting its report in a few moments. In addition, the committee asked the director, in consultation with the member state working group, to prepare a broad package of austerity measures. These decisions are set out in Resolution CESS 1.R2, which may be found together with a summary of the committee's deliberations in the final report of the special session, document CESS 1/FR. Thank you, Mr. President. This concludes my report on this item.
I thank the representative of the Executive Committee, and I understand that the office and Canada will be presenting this. They served as chair of the Member State Working Committee to review PAHO Strategic Priorities 2020-2021. I now give the floor to Mr. Dean Chambliss, Director of the Department of Planning and Budget, followed by Canada, for them to present this item. Mr. Chambliss, you have the floor.
Advance the slides accordingly. I would note that this presentation will briefly cover the main document for this agenda item and the Annex B report on the status of PAHO's financial situation and austerity measures implemented. Next slide, please. Please, the previous slide. Thank you very much. So in terms of the context for this document, as was noted in the report from the Executive Committee just given, the special session of the Executive Committee on 29th May 2020 reviewed the document CESS1/2, Current Financial Situation and Adjustments to the Pan American Health Organization Strategic Priorities. The resolution CESS1.R2 requested, 1, the establishment of a member state working group. It also requested the director to prepare a broad package of austerity measures and requested reporting on the above, as well as the status of the organization's financial situation, to this directing council. I would note, Mr. President, that with the significant improvement in PAHO's financial situation, the working group reoriented its work. The deliberations of that group and its recommendations to the 58th Directing Council are detailed in Annex A of the document. The Secretariat's internal deliberations also evolved, focusing less on immediate short-term cost reductions and more on ensuring PAHO's sustainable financial future, including keeping prudent cost containment measures in place, pending the receipt of additional assessed contribution payments. These measures and the current financial situation are detailed in Annex B. The request for a detailed outline with the consequences if the organization does not receive the assessed contributions nor has access to external borrowing that was requested in the resolution is not included in the document submitted, as it is no longer applicable. Next slide, please. At the end of April 2020, the assessed contribution outstanding for receipt by the organization was 164.6 million. However, as of the end of September 2020, the amount outstanding is down to 87.8 million. The chart that is given here depicts the level of outstanding assessed contributions, or the balance owed of assessed contributions by member states, around the middle of each year, starting in 2012 and bringing us up to 2020. Certainly, member states can observe the significant decrease between the amounts owed around mid-2019 and mid-2020. I would note that the figures differ here from the ones presented in the document in order to provide more updated information. The significant reduction in assessed contributions owed was due to the receipt of a large part of the assessed contribution arrears from 2019, as well as a portion of the 2020 contributions. I would note that although the balance due is much lower than last year, it is still notably higher than in previous years. Next slide, please. The flexible funds for the organization were initially expected to be around 357 million, or 58% of the $620 million base budget for 2021 of PAHO. As of the end of June 2020, the organization projected an accumulated budgetary deficit in flexible funds of 85.4 million by the end of the biennium, and a projected cash flow deficit of 51.2 million. These deficits reflected the significant cost-cutting measures already in place and meant that once internal borrowing of $15 million from the Master Capital Investment Fund was included and some other adjustments were made, approximately $33 million in fixed-term staff cost savings would have been required in order for the organization to remain solvent in the 2021 biennium. Accordingly, expenses in flexible funding were heavily curtailed at the time through cost containment or austerity measures, including a general freeze on fixed-term recruitment and drastic reductions to activities and short-term staffing. However, with the payment of assessed contributions in July, the situation as of mid-August improved considerably. with a projected budget deficit of $29.5 million and no cash flow deficit. The austerity measures that are currently in place may be progressively eased as and when the financial situation continues to improve. The Bureau is well positioned to ensure financial solvency throughout the 2021 biennium while adjusting its technical cooperation delivery to the new reality. Looking forward, we do anticipate what may be a challenging economic environment in the 22-23 biennium as member states recognize the full financial cost of the COVID crisis and make fiscal adjustments accordingly. Next slide, please. Of course, the financial situation has significant implications in terms of the technical cooperation that PAHO is able to provide to its member states. The austerity measures, as well as the current COVID-19 emergencies, have significantly affected the capacity of the organization to deliver its technical cooperation. The programs in countries that are heavily dependent on flexible funds have significantly reduced capacity to deliver technical cooperation across the full spectrum of public health needs. Key vacant positions that carry out core functions have been placed on hold. As I mentioned earlier, there has been a significant reduction in the activity component, which includes all non-fixed term staff expenses. And this has meant that PAHO has needed to adopt new and innovative modalities of technical cooperation in order to curtail expenses. While cost savings related to fewer face-to-face activities have allowed the organization to divert scarce funds elsewhere, this has somewhat offset the reduced activity component resulting from the austerity measures implemented. Next slide, please. The Directing Council is invited to take note of this report and provide any comments it deems appropriate. Thank you, Mr. President.
Muchas gracias. Canadá va a hacer presentación.
Thank you very much, Mr. President, and thank you for the presentation by Mr. Chambliss. So I will be reporting in my quality as having chaired a portion of the Member State Working Group meetings over the summer. So the special session of the Executive Committee held on May 29th this year established the Member State Working Group to review PAHO's strategic priorities for 2021. The terms of reference of the group were included in document CESS 1-2 as referred in the related approved resolution CESS 1.R2. The working group was composed of executive committee members and other member states that expressed interest in participating. In total, we had 18 member states in the working group, and Canada had the honor to be selected as chair of the group. The main objective of the working group was to provide input and advice to the director regarding strategic priorities for the organization in the worst-case funding scenario. The group was also tasked to consider a revision of PAHO's strategic priorities for 2021 as a consequence of the COVID-19 crisis, if deemed necessary. With these objectives in mind, the working group, in collaboration with the Secretariat, began its work in June. By mid-July, the Secretariat informed the group that PAHO had received a large assessed contribution payment totaling over $65 million, as indicated by Mr. Chambliss. As such, the worst-case scenario presented at the special session of the Executive Committee was averted. This meant that the raison d'etre of the working group was no longer what it was when it was established. Canada, as chair of the working group, welcomed the improved financial situation and made a proposal to the group to continue its work in line with the approved resolution. Canada proposed that the working group could make a strategic shift and consider a review of priorities as a consequence of the COVID-19 crisis. The working group concurred with the proposal, and the Secretariat was requested to present a review of the potential public health and economic impact of the COVID-19 crisis on the region of the Americas and its effects on PAHO's technical cooperation with member states. The working group concluded that although the Strategic Plan 2025 priorities should remain in place, in view of the COVID-19 impact on health systems, the Secretariat should continue adjusting its technical cooperation to member states in order to, first, strengthen its response to the current emergency, to preserve and boost the public health priorities during this protracted crisis, and to reinforce the resilience of national health systems. Any adjustment to the provisions of technical cooperation to member states should be implemented under the delegated authority of the director. Finally, the working group would like to recommend to the Directing Council the formation of an informal ad hoc group to contribute to the analysis of current and future technical priorities for the COVID-19 response, as well as associated public health challenges. With the submission of this report to the 58th Directing Council, the Member State Working Group concludes its work. Thank you very much, Mr. President.
Muchas gracias al señor Chambers y a la delegación de Canadá por el completo informe. Ahora le ofrezco el uso de la palabra al Pleno para iniciar el debate. Estados Unidos ha pedido la palabra. Adelante, Estados Unidos.
Thank you, Mr. President. The United States thanks the Secretariat for convening the special session of the Executive Committee in May and appreciates Canada's leadership of the Member State Working Group, as well as the support received from the Secretariat. The United States acknowledges the dire financial situation covered in the special session and is pleased that the financial situation has improved substantially, averting the worst case scenario with the receipt of a large portion of the assessed contributions. But we agree with Canada that PAHO should consider converting the working group to a technical or an ad hoc advisory group to explore at a more granular level what the organization should and should not be doing to address future financial situations and public health emergencies. As a technical group, it could advise on areas where PAHO could be more effective and efficient. As member states, we must become more disciplined in what we request of PAHO. This crisis increased member state engagement, and we need to ensure PAHO focuses on the priorities of member states in the region. Finally, we appreciate the Secretariat's efforts to ensure a sustainable financial future for PAHO, and we reiterate our thanks to Dr. Etienne for her leadership of this organization during these difficult months. Thank you.
Muchas gracias. Damos la palabra a la delegación de México. Adelante, México.
Gracias, presidente. Agradecemos ante todo la participación activa de los integrantes del grupo de trabajo, al mismo tiempo de congratularnos porque la situación financiera de la organización haya mejorado, evitándonos el escenario más desfavorable de financiamiento. Tomamos nota del informe del grupo de trabajo y respaldamos sus recomendaciones, principalmente en lo que respecta a la creación de un grupo ad hoc sobre el impacto de la pandemia de COVID-19 en la salud pública de la región. Manifestamos nuestra disposición para integrarnos a ese mecanismo y dar el acompañamiento que permite efectuar contribuciones al análisis de las prioridades técnicas actuales y futuras de la respuesta a la COVID-19. De igual manera, tomamos nota de las medidas de austeridad llevadas a cabo por el Secretariado y consideramos que si bien se han tomado acciones temporales para hacer frente a la reducción de fondos de la organización, existe aún un margen importante de acción que permita hacer frente a un contexto económico más desafiante en términos de disponibilidad de recursos financieros, por lo que será de vital importancia que el Secretariado tome medidas que, en consulta con los Estados miembros, aumenten la eficacia de la organización. Estas medidas deberán incluir una revisión de la estructura organizacional de la OPS a fin de identificar duplicidad de funciones en la sede, por lo que solicitamos a la directora presentar una propuesta a los cuerpos directivos que coadyuve a cubrir las áreas de oportunidad existentes a nivel organizacional y administrativo, priorizando que los recursos estén disponibles primordialmente a la cooperación técnica para los países. De igual forma, el secretariado deberá garantizar que los compromisos que se asuman en términos de gastos operativos generados a partir de contribuciones voluntarias nacionales no afecte la disponibilidad de los fondos flexibles de la OPS obtenidos a partir de otras fuentes. En ese sentido, nos llama la atención el déficit presentado por la organización para cubrir puestos que antes se financiaban con contribuciones voluntarias, por lo que nos gustaría que el secretariado presentara un mecanismo en materia que evite generar gastos operativos para cubrir actividades destinadas a proyectos que deberían financiarse por las mismas contribuciones nacionales. Gracias, presidente.
Muchas gracias. Damos la palabra a la delegación de Honduras.
Buenas tardes, señor presidente. Honduras agradece el informe sobre la situación económica actual y ajuste a las prioridades estratégicas de la Organización Panamericana de la Salud, elaborado por el Secretariado a solicitud del Comité Ejecutivo. Señora directora, nos alegra recibir este informe tomando en consideración el oscuro panorama que parecía tener la Oficina Sanitaria Panamericana y por lo tanto la misma OPS hace un par de meses, ya que afortunadamente gracias al cumplimiento del pago de las contribuciones señaladas de un buen número de países, se ha logrado pasar del peor escenario posible a un escenario que permite a la región, a la oficina, mantener su cooperación técnica, aunque sea de manera austera. Para países prioritarios como Honduras, es de vital mantener las funciones de la organización íntegras para mantener los logros y avanzar en los objetivos pendientes. Señores ministros y ministras, no podemos olvidar que vivimos en una gran comunidad, en una gran villa. La pandemia lo ha dejado más que claro. Los organismos internacionales como OPS y la OMS son indispensables para apoyarnos técnicamente a mantener el equilibrio de la salud pública internacional. Felicitamos a los grupos de trabajo por haber realizado en tan corto plazo un buen trabajo con recomendaciones estratégicas tanto a corto como a largo plazo, incluyendo la revisión de las prioridades estratégicas de la OPS en el bienio 2020-2021, como las medidas de austeridad aplicadas con sus debidas recomendaciones para mantener la autonomía de la organización y reducir los gastos innecesarios por medio de estrategias de optimización de recursos que nos viene bien a todos, inclusive a los Estados miembros. Señor presidente, tomamos nota del informe y exhortamos a todos los Estados miembros a que sigamos cumpliendo puntualmente con el pago de nuestras contribuciones señaladas. Muchas gracias.
Muchas gracias, señora ministra. Le damos la palabra a la delegación de Canadá. Adelante, Canadá.
Gracias, señor presidente. Quisiéramos comenzar por agradecer a la secretaria el informe presentado. También quisiéramos agradecer a todos los países que participaron en el grupo de trabajo de los Estados miembros, así como también las discusiones productivas, la camaradería demostrada y la apertura y franqueza con las que se discutieron temas críticos. We are pleased that PAHO has averted the worst-case financial scenario presented at the Executive Committee meeting this summer, allowing us to avoid the need for further substantial cuts to funding allocations for the 2020-2021 biennium. Canada believes it is important that we all endeavor to pay our assessed contributions without condition, in full and on time, as this is critical to ensuring the organization's survival, particularly when its assistance in the region is so critical at this time. We do also acknowledge that this is a challenging time for all member states, and there are financial pressures for all of us as we combat the COVID-19 pandemic in the region. In terms of the recommendations from the Member State Working Group, Canada fully supports the Director's authority to make financial and personal decisions on the organization's structure and reallocation of finances to ensure the organization continues to respond to the technical cooperation needs of Member States and looks forward to future updates on this point. We also agree that discussions on strategic priorities and budget allocations follow the organization's usual corporate planning and budgeting instruments and processes in light of the improved financial situation, which we hope will continue. Regarding the formation of a working group, we believe that it merits in establishing an informal ad hoc mechanism to provide a space for technical discussion on the impacts of COVID-19, the response and challenges. We feel it is important to provide member states the opportunity to engage with counterparts on these important issues. And lastly, we would like to acknowledge the work of the Secretariat in leading us through this financial crisis and the proactive changes which were made to focus on ensuring a sustainable financial future for PAHO and its longevity for another 115 years, including the cost containment measures that were put in place early pending receipt of additional assessed contribution payments, such as a partial freeze on recruitment, reduction to programmatic activities, and redirection of internal funds. Thank you very much, Mr. President.
Muchas gracias. Damos la palabra a la delegación de Brasil.
Obrigado, senhor presidente. Quero agradecer o trabalho do Canadá ao presidir o grupo de trabalho dos Estados-membros para analisar as prioridades estratégicas da OPAS para 2020 e 2021. O Brasil ficou feliz de poder contribuir com as discussões do grupo integrado por 18 países. Para o futuro, no entanto, sugerimos que, caso haja necessidade de dar continuidade ao grupo, que se pense talvez em dividi-lo em subgrupos, em prol da eficiência das discussões, sempre respeitando, claro, o princípio da proporcionalidade da representação. Apesar de o pior cenário ter sido afastado, o Brasil entende que a situação financeira da organização ainda é precária, necessitando de ajustes em suas prioridades. O Brasil está ciente de suas obrigações financeiras não cumpridas e quero que a OPAS saiba que estamos fazendo nossos melhores esforços para quitar o montante em aberto. Dado o impacto da pandemia, os recursos, tanto financeiros quanto humanos, são escassos e, claro, a necessidade de adaptar a cooperação técnica, com vistas a adotar intervenções de saúde mais custo-efetivas, não só para o enfrentamento da Covid, mas também para outras prioridades da região. O Brasil está de acordo com as deliberações e recomendações presentes no relatório, conforme anexado ao documento CD 58.8. Muito obrigado, senhor presidente.
Muchas gracias a Brasil. Le damos la palabra a Colombia.
Gracias, señor presidente. Queremos manifestar nuestro agradecimiento con la Secretaría por el documento presentado, en el cual vislumbramos con mucha satisfacción la mejoría considerable de la situación financiera de la organización. Nos complace haber aportado en este alivio financiero efectuando el pago de las contribuciones correspondientes al año 2019 y 2020. De igual forma, agradecemos a la organización por los esfuerzos realizados para mantener a flote las actividades de asistencia y cooperación técnica en medio de la difícil situación financiera y alentamos a la directora a continuar aplicando de manera sostenible medidas de austeridad en el gasto y a seguir haciendo uso de herramientas que han resultado efectivas en medio de esta pandemia, como la virtualidad, para generar eficiencias administrativas. También queremos, señor presidente, resaltar la labor del grupo de trabajo de los Estados miembros, cuyas deliberaciones aportaron el proceso de revisión de prioridades estratégicas y a la revisión de desafíos y oportunidades de cooperación de la OEPS en el marco de la actual pandemia. Al respecto, manifestamos nuestro apoyo a las recomendaciones presentadas por el grupo de trabajo sobre cómo avanzar en materia de revisión de prioridades estratégicas de la organización y sobre cómo abordar los retos, ajustes y oportunidades de la cooperación técnica en los Estados miembros en el marco de la actual pandemia. La adaptación de la organización a la nueva realidad y la armonización de las prioridades estratégicas con los retos que impone la actual pandemia resultan claves para garantizar el apoyo de los Estados miembros para responder a las necesidades actuales y la atención efectiva a la emergencia ocasionada por la COVID-19. Finalmente, confiamos en que la organización prudentemente suavizará las medidas restrictivas y excepcionales conforme mejore la situación financiera, de manera que se garantice la solvencia económica para el próximo bienio. Muchas gracias, señor presidente.
Muchas gracias a Colombia. Damos la palabra al Organismo Andino de Salud, Convenio Hipólito Unanue. Adelante.
Bueno, buenas tardes. Gracias, señor presidente, por darme la palabra. Ante todo, queríamos agradecer profundamente todo el apoyo que hemos recibido de la Organización Panamericana de la Salud y de la Organización Mundial de la Salud también. Nuestros países, Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela están muy comprometidos en esta pandemia. Estamos hablando de más de 2.400.000 personas infectadas, más de 90.000 fallecidos, pero también podemos hablar de 2 millones de recuperados en la pandemia. Nosotros, queremos compartir que se han realizado reuniones técnicas, webinars, en los cuales se ha intercambiado todas las experiencias, las lecciones aprendidas, y tenemos reuniones con autoridades sanitarias de los 6 países para hablar de los desafíos, los retos y obviamente los siguientes pasos. Consideramos muy importante el trabajo de los comités y hemos priorizado obviamente todo el tema de migrantes, pueblos indígenas, salud de las fronteras y el tema de vacunas. Fuimos los primeros en presentar el mecanismo COVAX a los países de nuestra subregión. Pero para poder lograr todo esto tenemos que contar con los presupuestos necesarios, ¿no? Y sabemos muy bien que sin presupuestos y sin apoyo financiero no se pueden ejercer los derechos. Así que consideramos muy importante todo lo que se está decidiendo. Solamente queremos seguir invitándolos a trabajar juntos por esta nueva visión, que la salud y el bienestar sea el eje del desarrollo social y equitativo para toda la humanidad. Muchas gracias.
Muchas gracias, Aloras. Nos ha pedido la palabra Paraguay. Adelante, Paraguay.
Buenas tardes, presidente y Estados miembros. En general, la delegación de Paraguay no encuentra objeciones a lo planteado, teniendo en cuenta la situación económica y los escenarios posibles. No obstante, quisiéramos tener más información, si es factible, sobre 2 aspectos. 1. ¿Cuáles fueron o se analizaron los impactos en los países prioritarios? Paraguay es uno de los 8 países. Sobre las medidas de reducción de costos que se aplicaron o aplicarán. Y el segundo punto es si la organización establecerá medidas a ser aplicadas a todos los países miembros por igual o habrá alguna clasificación según estén al día con los compromisos. Finalmente, consideramos muy importante la comunicación permanente con los Estados miembros acerca de la situación económica y financiera, lo cual agradecemos a la directora. Además, destacamos el esfuerzo y la dedicación del grupo de trabajo de los 18 Estados miembros para examinar las prioridades estratégicas de la OPS en el bienio 2020-2021. Gracias, señor presidente.
Muchas gracias al Paraguay. Le damos la palabra a Haití. Adelante, Haití.
Merci, Monsieur le Président. Haïti remercie le secrétariat pour ce rapport et salue le leadership de la directrice. Haïti a, malgré toutes les difficultés financières, acquitté sa contribution de 2019 et de 2020. Haïti félicite tous ceux qui ont travaillé très dur dans le groupe de travail et nous supportons la proposition faite par le groupe de travail. Nous encourageons tous les pays à payer leurs contributions car nous venons de voir l'importance de notre organisation en cette période difficile de la COVID-19. Je vous remercie.
Muchas gracias, Haití. Le ofrezco el uso de la palabra a el señor Chambliss y a Canadá para responder brevemente a los comentarios. Gracias. Adelante, señor Chambliss.
Thank you very much, Mr. President, and thanks to the member states for their interventions. I will attempt to sum up. I think there were a number of them that were forward-looking, both in terms of the current biennium as well as looking forward to the 22-23 biennium. But this first specifically to the questions just asked by Paraguay, the impact on priority countries, we always try to favor and, if you will, protect priority countries in terms of both our budget allocations and our funding allocations. And I think it's fair to say that that effort has continued even during the COVID crisis. So certainly priority countries, to the extent possible, have been protected as far as the austerity measures go that we've been discussing. As far as the relationship between austerity measures and what I understood to be the question, is there a relationship between assessed contribution payments and austerity measures? And the answer is no, there is not a relationship there. Moving, Mr. President, more broadly, certainly for the 2021 biennium, as I mentioned in my presentation, the organization will continue to keep in place the necessary austerity measures and will adjust those accordingly with the financial situation and certainly with in keeping with the receipt of future assessed contribution payments more specifically. We will, of course, keep member states informed regarding the evolving situation. I believe the next opportunity will be during the SPBA subcommittee meeting in March of next year. More broadly, next year, of course, is a budget year. We will be presenting during the course of the governing bodies meetings next year the program budget for 22-23. And that will be a major opportunity for us to look at the very unusual experience of the 2021 biennium, both from the financial perspective as well as from the COVID technical perspective. And we'll have to look at how this will impact on what we present for the 22-23 biennium, as well as, of course, keeping in mind the financial situation of member states. There are a number of internal initiatives underway in order to ensure that PAHO is fit for purpose, looking forward to the 22-23 biennium, and these include all elements of the Secretariat in terms of structure, functional assignments, etc. And those will, of course, be reflected in the program budget proposal that member states will have a chance to review next year. Thank you very much, Mr. President. I hope I've addressed the questions and comments. Over.
Muchas gracias, señor Chambers. Tiene la palabra la delegación de Canadá. Adelante, Canadá.
Thank you very much, Mr. President. I don't think we have anything to add at this point. Thank you very much.
Muchas gracias. Muchas gracias a la delegación de Canadá. Ahora le ofrezco el uso de la palabra al Pleno para iniciar el debate. Álvaro, ya se han respondido los comentarios. Señora directora, ¿quiere hacer algún comentario?
Mr. President, I want to take this opportunity to thank all member states who have made good on their assessed contributions and to encourage those who have not to do so or even enter into payment plans to do so. Let me thank all of the countries who participated in the member states working group for their work, and to thank Canada for chairing this group. I will commit that the Secretariat will take action on the formation of the working group, and I think this is a good time, particularly as we are going to be entering the planning for the 22-23 biennium, that the deliberations of that group would feed and information into the member states working group, which we usually put together in terms of the biennial planning. So let me say also that the director is quite aware of the need to ensure that this organization remains fit for purpose and that we can survive despite the many challenges. So we have embarked on a significant internal, I don't like transformation, but certainly transformation, both in terms of structure, in terms of our function, in terms of our modus operandi, very much with the objective of becoming more efficient, becoming more relevant, and becoming more effective in the delivery of our technical cooperation. Thank you to all. Over.
Muchas gracias a la directora. Informo al Consejo que el debate constará en el informe final. En este punto entramos a un breve receso de 10 minutos. A las 4 horas y 5 minutos estaremos de regreso. Muchas gracias.
Siempre fue un sueño trabajar en un lugar donde se puedan hacer cosas que marquen la vida de las personas. Y creo que el club marca históricamente la vida de muchas mujeres y de muchos recién nacidos.
Durante estos 50 años, CLAP ha atravesado distintas etapas, acompañando hasta el presente las necesidades de la región para mejorar la salud de las mujeres, las madres y los recién nacidos.
Se fue migrando desde la investigación básica, la investigación esencial, a la investigación en salud pública y a la implementación de programas en salud pública.
En ese camino es muy importante la acción histórica del CLAP en el desarrollo de los materiales de capacitación, los instrumentos para la atención.
Durante un periodo de tiempo el CLAP se dedicó específicamente a hacer medicina basada en evidencia. Producíamos publicaciones para que le llegara a la gente en su propio idioma con las cosas más actuales.
Las investigaciones del CLAP permiten desarrollar buenas prácticas basadas en la evidencia que luego se trasladan a los países de la región de las Américas.
Lo que tratamos de hacer es encontrar a los docentes de medicina, de enfermería, de partería, para que sean los primeros que se entrenen.
CLAP ha expandido el CIP no solamente en términos geográficos, sino también se ha expandido a diferentes subgrupos, como por ejemplo recientemente se ha creado el CIP COVID-19.
La OPS siempre trabaja para lograr la salud universal. Este sueño no se alcanzará sin contemplar las necesidades de las mujeres, las embarazadas y los recién nacidos. Mediante la labor del CLAP, la OPS trabaja para que este sueño se haga realidad.
Duérmete mi sol, duérmete pedazo de mi corazón.
As COVID-19 continues to spread across the world, PAHO recommends that mothers who are able to breastfeed should continue to breastfeed their babies during the pandemic. This includes mothers with suspected, probable, or confirmed COVID-19 infection. However, maintaining good respiratory and hand hygiene are essential. Good hand hygiene means washing hands before and after contact with the baby. Wash your hands with soap and clean running water for at least 20 seconds, or use an alcohol-based hand sanitizer if soap and water are unavailable. Use paper towels to dry your hands after washing and dispose in a closed bin after use. Good respiratory hygiene means wearing a protective mask when near the baby. Mothers and babies should remain together and practice skin-to-skin contact whether or not they or their infant have suspected, probable, or confirmed COVID-19 virus infection. When removing the mask, do not touch the front. Discard immediately after removal and wash your hands. Cleaning and disinfecting surfaces will minimize the spread of the virus. Get COVID facts. Contact the Ministry of Health and Wellness or PAHO for more information.
Wash your hands with soap and water. Having clean hands reduces the spread of diseases like COVID-19. Let's show you how to do it. After wetting your hands, close the tap. Add soap and lather your palms. The back of your hands, between your fingers. Back of fingertips in your palm. Your thumbs. The tips of your fingers in your palm. And don't forget your wrists. Use a tissue to open the tap, as this was last touched by your unwashed hands. Rinse your hands thoroughly. Finally, use tissues to dry both hands and discard in the bin. During this 50 seconds of hand washing, we had the tap running for only 7.5 seconds, saving 85% of water otherwise wasted. Water is a precious resource, it is scarce. So as you wash your hands, don't waste water. We are PAHO and we care. This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and the Grenadines to assess their capacity and provide technical assistance and training in response to readiness. Virtual meetings took place with senior health officials of the Ministries of Health to identify gaps, needs, and challenges requiring PAHO's technical cooperation. National plans in all areas of response were reviewed to assess potential public health measures. Over 20 webinars were hosted to engage young people, those living with NCDs, health professionals, and representatives of the hospitality industry. Videos, posters, flyers, and social media cards on key public health messages were produced and disseminated. Over 80 bulletins and situation updates on preparedness and response activities were produced and disseminated. High-level briefings were conducted for ministry officials, diplomatic community, media, and business groups. Countries and territories were introduced to the Go Data software for data capturing and analysis of the chain of transmission. They also received training on the mathematical modeling of COVID-19 cases. Entry protocols for the reopening of borders were reviewed and guidance provided to national health authorities. Infrastructure for case detection at points of entry was strengthened through the provision of equipment such as thermal imagers and IT tools for data collection at main airports. Countries were supported on readiness and response measures at ports of entry. A webinar on considerations for resuming non-essential travel in the Caribbean was organized. Government ministers participated. PAHO played a major role in the procurement of PCR machines, test kits, and accessories. Approximately 46,055 PCR kits, consumables, and other reagents have been procured. Laboratory capacity for PCR testing in Barbados and the Eastern Caribbean countries has increased from 2 in February to 7 at present. Many countries received training in methods of COVID-19 diagnostics. A webinar on scaling up laboratory testing in the Caribbean was successfully conducted. We facilitated infection prevention and control training sessions for over 750 health workers and personnel in the hospitality sector.
Seguimos con la sesión. Punto 2.3, establecimiento de un grupo de trabajo para estudiar la aplicación del artículo 6b de la Constitución de la Organización Panamericana de la Salud. Le concedo el uso de la palabra al delegado de El Salvador, presidente del grupo de trabajo para estudiar la aplicación del artículo 6b de la Constitución de la Organización Panamericana de la Salud, para que presente el respectivo informe. Adelante, delegado de El Salvador.
Gracias, señor presidente. Primero agradecer a los representantes de Aruba y Trinidad y Tobago, quienes con El Salvador conformamos el equipo de trabajo, y por sus discusiones claras y sinceras, además de la colaboración del equipo de apoyo de OPS. El informe reza de la siguiente manera. Número 1, el grupo de trabajo se ha establecido para estudiar la aplicación del artículo 6b de la Constitución de la OPS en reuniones que han tenido lugar el 28 y 29 de septiembre, la situación de la recaudación de las contribuciones señaladas y la aplicación de la suspensión de los derechos de voto de cualquier estado, mientras que tenga atrasos que excedan del importe de los pagos anuales de sus cuotas correspondientes a 2 años completos en la fecha de inauguración del Consejo Directivo. El número 2 corresponde al grupo de trabajo recomendar sobre si procede o no restablecer los derechos de voto de los países según dispone el artículo 6b. La conferencia o el consejo directivo podrán permitir que dicho miembro vote si se considera que la falta de pago se debe a condiciones fuera del control del gobierno. Numeral 3, los miembros del grupo de trabajo son los delegados de Aruba, El Salvador y Trinidad y Tobago. Preside el grupo de trabajo el delegado de El Salvador. Numeral 4, a la apertura del 58º Consejo Directivo, un Estado miembro, Venezuela, estando en curso en la situación prevista en el artículo 6b, al tener las cuotas de 2017, 2018, 2019 y 2020 pendientes de pago con un importe total adeudado de $7.854.219. Por consiguiente, en aplicación de lo dispuesto en el artículo 6b, Venezuela ha perdido su derecho de voto a la apertura de esta sesión de Consejo Directivo. El numeral 5, el día 24 de septiembre, Venezuela presentó al secretariado un plan de pago a 20 años que no incluía ningún pago de las contribuciones en este año 2020 y que tampoco señalaban fechas de pago concretas en los años 2021 y siguientes.
Perdón, doctor. Aparentemente tenemos dificultades en la interpretación al inglés. Entonces, qué pena tener que interrumpirlo, pero una vez más es un tema importante. Sería importante que todos acompañaran su reporte. Quisiera primero pedir el apoyo suyo y los colegas que le están apoyando se pueden ir al icono de interpretación en la parte de abajo de la pantalla y hacer mudo el audio original. Esto a veces resuelve el problema. Mudo en el audio original y después se puede, por este momento, deshabilitar la interpretación a los otros idiomas desde su máquina. ¿Estamos bien? Pues
Ahorita, ¿me escucha?
Se puede...
Estoy probando.
¿Se puede seguir un poquito más para que podamos confirmar que se le escucha bien? Aprovecho para saludarnos a todos en esta tarde, después de este día tan largo.
¿Me escucha en este momento?
Le escuchamos. ¿Se puede seguir hablando un poco más extendido para que podamos confirmar que la interpretación se está pudiendo hacer desde su...
Perfecto. Perfecto. Lo retomo en el numeral 4.
Si por favor pudieras retomar desde el principio. Qué pena. Pero la recomendación sería retomar desde un principio.
Perfecto, perfecto.
Muchas gracias.
Sí, bueno, el numeral 1, el grupo de trabajo se ha establecido para estudiar la aplicación del artículo 6b de la Constitución de la OPS que ha revisado en reuniones que han tenido lugar el 28 y el 29 de septiembre. La situación de la recaudación de las contribuciones señaladas y la aplicación de la suspensión de los derechos de voto de cualquier Estado miembro que tenga atrasos que excedan del importe de los pagos anuales de sus cuotas correspondientes a 2 años completos en la fecha de inauguración del Consejo Directivo. Numeral 2. Corresponde al grupo de trabajo recomendar sobre si procede o no restablecer los derechos de voto de los países según dispone el artículo 6b. La conferencia o el consejo directivo podrán permitir que dicho miembro vote si considera que la falta de pago se debe a condiciones fuera del control de gobierno. Numeral 3. Los miembros del grupo de trabajos son los delegados de Aruba, El Salvador y Trinidad y Tobago. Preside el grupo de trabajo.
And the working group was chaired by the delegate of El Salvador. 4. At the beginning of the 58th Directing Council, a member state, Venezuela, was in the situation contemplated by 6B, in that the quotas for 2017, 2018, 2019, and 2020 were in arrears for a total amount of $7,854,219. Consequently, In applying the provisions of Article 6b, Venezuela has lost its right to vote at the beginning of this meeting of the Directing Council. 5. On the 24th of September, Venezuela submitted to the Secretariat a 20-year payment plan without including payment of contributions for this year, 2020. Nor did said plan give any concrete payment dates for 2021 or subsequent years. Because of the late submission of this payment plan to the Secretariat, it had been impossible to establish a conversation about this proposal with Venezuela. The Secretariat has indicated that the organization had not accepted such delayed payment plans in the past, but that the WHO had done so. Number 6, the working group has invited Venezuela to present its proposal. Venezuela is acknowledging its delay in the payment of assessed contributions, its debt with the organization, and also the amounts owed to the revolving vaccine fund and the strategic fund has presented the reasons beyond their control, the reasons why they have not been able to make payments because significant amounts of money have been blocked abroad and consequently they cannot make payments abroad. All of this means that they cannot transfer funds outside of Venezuela. Venezuela has committed to making a payment of $392,000 immediately, but without being able to transfer funds abroad or make payments in the first quarter of future years. On the 29th of September, Venezuela sent to PAHO a written document ratifying what was said verbally in the meeting held the previous day, indicating that at this time payments cannot be made abroad. 8. The working group has reviewed the recommendations of the 166th meeting of the Executive Committee in its resolution F-166R4, as well as the correspondence and the proposed payment plan on the part of Venezuela and its statements during meetings, as well as the comments of Secretariat. 9. The working group analyzed and debated the delay in payments on the part of Venezuela, underscoring the importance of prompt reception of the payment of assessed contributions. This is important so that we can execute the approved program, and pointing out that when contributions are not received on time, this puts in peril implementation of the activities foreseen and even the continuity of the organization, and it's necessary to take extraordinary measures for financial management. Also, it was pointed out that it is not advisable to create exceptions in the application of Article 6b that could be alleged by other member states if they do not comply with their financial commitments. So based on that, the working group formulated its recommendation, and the recommendation says, considering the lack of payment, the working group recommends that the Directing Council not reestablish the right to vote for Venezuela and that the situation be reviewed again by member states in future meetings of the governing bodies. However, the members of the working group do understand that Venezuela has not paid for reasons that are beyond their control and consequently is recommending that the Council call on member states to find mechanisms that would allow Venezuela to transfer funds. Now, We do congratulate all member states that have done everything possible to comply with their financial obligations with PAHO in 2020, especially in the difficult circumstances of coping with COVID-19 and the difficult economic situation that has resulted from COVID, and calls on member states that have outstanding contributions for 2020 to please honor those obligations with no further delay. Thank you. Thank you. I thank the chair of the working group, and we offer the floor for any discussion of this report. We hear no objections. So the report is approved, and we can move on to the next agenda item. Item 5.1, report on the collection of assessed contributions. I would ask the rapporteur to present the proposed resolution. You have the floor, sir. Thank you, Mr. President. Agenda item 5.1, report on the collection of assessed contributions. I'm sorry. I realize that this report was not presented in its entirety. So here I would bring to your attention this document with addendum 1, CD 58/9, and here I would ask the representative of the executive committee to report on this item. So I would ask the executive committee to speak at this point.
Mr. President, the executive committee was informed that as of June 22nd of this year, outstanding assessed contributions due from member states, participating states, and associated members had amounted to $160.3 million, including $66.1 million that remain outstanding from 2019. During the first half of 2020, only $33.9 million were collected. One member state was in arrears to the extent that it could be subject to the application of the provisions of Article 6.b of the PAHO Constitution. The committee was also informed that the level of unpaid assessed contributions was unprecedented in the history of the organization and that the situation had brought PAHO to the brink of insolvency. Thanks to cost containment measures and other steps taken, the Bureau expected to be able to continue operating, albeit at a minimum level, until the end of 2020. However, the committee was told that unless a significant proportion of the outstanding assessed contributions was received, far more radical steps would be required in 2021 to curtail the organization's activities and reduce its staff. In the committee's discussion, PAHO's critical role in addressing the COVID-19 pandemic was highlighted, and it was emphasized that it is not in any country's interest for the organization to have to undertake that role while also grappling with severe financial constraints. The importance of paying assessed contributions in full and on time was underlined. The committee adopted Resolution CE 166.R4, thanking the member states that had made payments for 2020 and strongly urging other member states to pay all outstanding contributions as soon as possible. Thank you, Mr. President. This concludes my report on this item.
I thank the representative of the executive committee for that report, and I call on Mr. Puente Chaude, who is the Director of Finance, to present his report. Mr. Chaude, you have the floor. Thank you very much. Madam Director, distinguished members of the Directing Council, it is my pleasure to present my report on the collection of assessed contributions. As you can see on the left, in the 9 months prior to holding the meeting of the Directing Council, we have collected $106.5 million. Of the $106.5 million, that is for the first 9 months of the period, 67.7% correspond to prior years. That is in dark blue, and only 38.8 are for the collections in the current year. As you can see, the total collection in 2020 have improved significantly when compared with 2019. It more than triples the total amount collected. But what we received basically this year has been contributions in arrears. That is in dark blue. Now, in terms of the current year's quotas, we have only received 37%, and we are 3 months from the end of the year. As a result, and now we could go to the right side of the screen. As a result, the assessed contributions is $87.7 million. That is the column on the far right. That is an amount below where we were in 2019, where we were almost at 122 million, but you can still see the number or the amount in outstanding assessments. It is higher than what it had been in previous years. 23 countries have paid their contributions for 2020 in full. 6 have made partial payments, and 13 have not made any payment towards their 2020 assessed contributions. One member state has arrears such that they are subject to Article 6B. Now, in terms of the contributions, by the 31st of August, we had used the totality, the 25 million from the Working Capital Fund, and we had used 24 million in other unrestricted resources. And lastly, I would like to thank Bahamas, Barbados, Bolivia, Canada, Colombia, Cuba, Dominican Republic, Ecuador, Guatemala, Guyana, Haiti, Honduras, Jamaica, Nicaragua, Panama, Paraguay, St. Kitts and Nevis, St. Lucia, Suriname, Trinidad and Tobago, Netherlands, Aruba, for having complied on time with their commitment for making a full payment of the 2020 assessed contribution, supporting both PAHO and Health in the Americas at this critical juncture. I would call on those members that have not paid their contributions in full to please do so with no further delay to avoid endangering the activities of the organization. I am available for any questions that you may have. Thank you very much. Thank you, Mr. President.
Thank you, Mr. Puente Chaudet. Let me now give the floor to the plenary for discussion. Colombia has the floor. Thank you very much, President, and let me begin by congratulating you and saying how important it is for Colombia to have you chairing this session. It's an honor to address this council to reiterate gratitude to PAHO, not only because it plays a fundamental role in regional reaction to COVID-19, but for supporting our countries in attainment of the targets that we have set forward in the public agenda throughout the Americas, in order that everyone may enjoy a productive, healthy life. Today, I would like to point out that we are convinced that we cannot allow the operational capacity of the organization to be hindered and jeopardized by the financial obligations of member countries, because the right financing is essential to save lives, protect life of all persons in the continent. I'd like to point out that we are aware of the organization's financial difficulties and the need to continue working with PAHO, addressing the national and regional health challenges. Therefore, we reiterate Colombia's commitment in payment of assessed contributions. The recent payment of Colombia's full payment, despite the financial difficulties of the country, is proof of our support for the organization. Lastly, we encourage those members who have not yet made their 2019-2020 contributions to please do so. And we firmly support the proposed resolution and that implementation of 6.b of the Constitution of PAHO be applied, because those rules are set forth to be complied with. Thank you. Thank you very much, Colombia. I now give the floor to the delegation of the United States.
Thank you, Mr. President. The U.S. delegation thanks the Director for the report on the collection of assessed contributions. We note that the status of contributions is comparable to previous years. The United States pays assessed contributions to PAHO on a deferred basis, as we do to other large international organizations. As of this date, the United States has paid contributions for the first 2 quarters of this calendar year and will pay an additional contribution sometime between October and December, depending on our own appropriations process. Thank you, Mr. President.
Thank you very much, United States. Honduras is now recognized. Thank you, President. Honduras agrees with the report on collection of assessed contribution, both the current and those from previous years. The document is clear, precise, and points out that delays in payment of contribution jeopardizes the operations of the support plan and operations of PAHO itself, and therefore the development of strategies in assistance of member and associated countries, especially in the framework of the current situation of the COVID-19 pandemic. We would like to congratulate those member states that have complied with their financial contributions vis-à-vis the organization, making efforts to pay their pending contributions, and urge other member states to pay the full assessed contribution that is outstanding at present, in order to not jeopardize the technical cooperation activities and the economic solvency of the organization. An effort is required, despite the health situation, in the framework of solidarity, to have a shared vision of priorities. Honduras, from the Health Secretariat, has started processing payment of its assessed contribution for the current year. We'd like to ask the plenary that this report be approved. And Madam Director, please present a measure of a plan of austerity measures to support the current plan, and request the countries that they participate in the process. Thank you, President. Thank you very much, Honduras. Canada is now recognized.
Minutes mandate, implement the approved program of work, and deliver results. As a strong supporter of effective multilateral institutions like PAHO, Canada pays its assessed contribution in full, on time, and without conditions. We encourage others to do the same, as just stated by a few fellow member states. And these funds are necessary in ensuring the organization's financial stability and in supporting PAHO's continued delivery of its vital assistance to the region. Thank you very much, Mr. President.
Muchas gracias a la delegación de Canadá. No teniendo más países que han pedido la palabra, le damos la palabra al señor Puente Chaudé para así indicar si tiene algún comentario en particular.
Muchas gracias, señor presidente. No tengo ningún comentario, tan solo agradecer las palabras de Colombia, Estados Unidos, Honduras y Canadá y por su apoyo, no solo financiero, sino también con sus intervenciones en esta materia. Gracias.
Muchas gracias. Señora directora, ¿tiene usted algún comentario?
Yes, Mr. President. Again, I take the floor to thank member states who have duly made their payments of assessed contributions. Let me tell you that for a director, the budgetary process assumes that you have paid your assessed contributions by the 1st of January. And so with a lack of predictability as to when you're going to pay or if you're going to pay assessed contributions, it makes it doubly difficult to manage the resources and to ensure that we can deliver technical cooperation. So I will thank you for those who have met their obligations, and I appeal to those who have not yet made those obligations to make good on them. Thank you very much.
Muchas gracias, directora. Le pido ahora al señor relator que presente el proyecto de resolución. Adelante, señor relator.
Gracias, señor presidente. Punto 5.1 del orden del día. Documento Consejo Directivo 58/9. Adende. Recaudación de las contribuciones señaladas.
Contributions. The 58th Directing Council 1, having considered the report of the Director on the assessed contributions in document addendum 1 and the concern expressed by the Executive Committee at its 166th session with regards to assessed contributions 2, observing that the Bolivarian Republic of Venezuela is in arrears in the payment of its assessed contributions, such that it is subject to Article 6b of the Constitution of the Pan American Health Organization. 3, noting that as of 29 September 2020, 3 member states have not made any payments towards their 2020 assessed contributions. 4, noting that as of 29 September 2020, only 37% of assessed contribution for this year have been received, forcing the organization to utilize the working capital fund and other unrestricted resources. Resolves 1, to take note of the report of the Director on the collection of assessed contributions, document CD 58/9 and addendum 1 presented by the Director. 2, to express appreciation to those member states that have already made payments in 2023, to strongly urge all members with outstanding balances to meet their financial obligations to the organization in an expeditious manner in order to efficiently implement the program budget for 2020-2021. 4, to request the President of the Directing Council to notify the delegation of the Bolivarian Republic of Venezuela that its voting rights have been suspended as of this 58th session of the Directing Council. 5, to request the Director to A, to continue to monitor the status of assessed contributions and the impact of delays on the financial health of PAHO. B, to advise the Executive Committee of Member States compliance with their financial commitments to the organization. C, to report to the 59th Directing Council on the status of collection of assessed contributions for 2021 and prior years. Thank you very much, Rapporteur. I yield the floor to the plenary to begin the discussions. Understanding that there are no objections, I declare this resolution adopted. We move to the next agenda item, 4.1, report of the end of biennium assessment of the PAHO Program and Budget 2018-2019, and final report on the implementation of the PAHO Strategic Plan 2014-2019. I'd like to draw document CD 58.5 and Addendum 1 to the attention of the Council and invite Mr. Dean Chambliss, Director of the Department of Planning and Budget, to present the item. Mr. Chambliss, you have the floor.
I would like to say a massive thank you to all of those who have been involved in producing this report. As always, it is a major undertaking for the organization, and I must say that this year, with the full engagement of many PAHO staff in the COVID-19 response, it has been even more challenging. I would also like to note that in 2012-13, a dozen member states spent long months together with the Secretariat developing the strategic plan 2014 to 2019. And I do recognize that it is late on the day of this abbreviated directing council. Nonetheless, I will devote some time to accounting for the highest level targets set in the plan, since these are, at the end of the day, what all of PAHO, the Bureau, and the member states have been working towards for the past 6 years. I will attempt to present as quickly as possible, while of course, respecting our interpreters. Next slide, please. This report presents a final appraisal of the Strategic Plan 14 to 19 impact targets, the achievements, the challenges, as well as the country success stories. It presents the report by category. It presents budget implementation, a risk analysis, as well as lessons learned that are to be applied in the 2020 to 2025 period. This report builds on the successful practice in the organization of ensuring collective accountability for the results set out in program budgets and in the strategic plan. However, unlike the end of biennium assessments for 2014-15 and 2016-17, this assessment for 18-19 is an internal assessment only, conducted by the Pan American Sanitary Bureau, and it is not the habitual joint assessment with member states. This is regrettable, however, due to the difficulties in conducting a joint assessment of the outcome and output level indicators at a time when our countries are fully occupied responding to COVID-19. We simply could not complete the assessment this year. PAHO, of course, remains ready to support individual national health authorities that wish to complete their own assessment. And we look forward to the joint assessment process resuming after the 2021 biennium. I note that this report is presented in 3 sections. 2 of those sections are presented to the Directing Council: the executive summary and the addendum, which is the report on results. The third part, which is the 6 category level reports, are made available on the PAHO program budget portal. Next slide, please. This report provides a final assessment of the 26 impact level targets in the strategic plan. According to the results chain in the strategic plan, the impacts represent sustainable changes in the health of populations, to which the work of PAHO's member states, the Bureau, and other partners contributes. These normally refer to changes in mortality, morbidity, and health access. The results show that as of 2019, the region has made great strides, although major challenges remain. The pie chart here provides a high-level view of all of the impact targets, with 31% having exceeded the target set, 23% having achieved the targets, 19% with partial achievement, and 27% not achieved. The following slides will be presented goal by goal with the appropriate shading of the different goals depicting the level of achievement. Next slide, please. The first goal, to improve health and well-being with equity, included one target that measured healthy life expectancy, or HALE. HALE is a measure of population health that combines life expectancy and the quality of life. Member states will recall that the HALE is central to the WHO GPW 13 results framework and to the PAHO Strategic Plan 2025. For the 14-19 period, we are projecting a reduction of 0.2% in the HALE, which unfortunately is moving in the opposite direction from the target. The second goal was to ensure a healthy start for newborns and infants. It was measured by the infant mortality rate, the number of infant deaths per 1,000 live births. The regional target was to reduce the rate by 15%, and the actual change was a 13.9% reduction, which, although not quite up to the target, was within the window of 90 to 100%, and therefore is considered achieved. I would note that this goal, as well as the following three goals, each include two measures of health inequalities: the relative inequality gap and the absolute inequality gradient. These measures represent the commitment of member states and the Bureau to go beyond mere regional averages in order to reach those most in need. The relative inequality gap measures the ratio between the bottom and top country groups on the Health Needs Index Expanded, or HNIE. The absolute inequality gradient measures the excess deaths that are observed across the HNIE gradient as quantified by the slope index of inequality. In this case, although the relative gap target was only partially achieved, the absolute gradient target was exceeded. Next slide, please. The third goal was to ensure safe motherhood. The regional target was to achieve at least an 11% reduction in the regional maternal mortality ratio by 2019. However, the projection is that the MMR fell by 9.4%. Of course, this is important progress, but falls short of the target. The relative gap target was achieved, and the absolute gradient target was exceeded. The analysis shows significant variations, however, between and within countries, suggesting the need to boost efforts to improve maternal health where it is needed most, particularly among PAHO's key countries. Goal 4 was to reduce mortality due to poor quality of health care. It was measured by the rate of mortality amenable to health care and is an important measure of both access and quality. The regional rate did fall during the period by 6.5%, although not enough to meet the 9% target. However, the assessment also shows that the risk of dying from poor quality of care due to social inequalities fell during the period, with both the absolute and relative targets exceeded. Next slide, please. Goal 5 was to improve the health of the adult population with an emphasis on non-communicable diseases and risk factors. It was measured by the premature NCD mortality rate. Although there was an overall regional reduction of 4.9%, this is about half of the 9% target. While the absolute inequality gradient target was achieved, the relative inequality gap to limit the increase in the gap to no more than 6% was not met. In fact, the gap rose by over 10%. Reducing premature mortality due to NCDs is a complex undertaking requiring political support and resource allocation for legislation that promotes multi-sectoral policies, regulations for risk factor reduction, and health system strengthening for the management of NCDs. Goal 6 was to reduce mortality due to communicable diseases. This goal had 4 proxy targets to reduce mortality due to HIV/AIDS, dengue, tuberculosis, and malaria. 2 of the 4 were achieved, HIV/AIDS and dengue, while TB and malaria were not. In the case of TB, there was a drop in the mortality rate by 4.1%, but not enough to meet the 24% target. For the regional target of a 75% reduction in deaths due to malaria, there were major setbacks. The massive increase in malaria transmission in Venezuela since 2015 has been associated with a significant increase in mortality in that country, and therefore the actual change was a 200% increase. Without considering Venezuela, there was a 47% reduction in the number of deaths. Therefore, even from this perspective, the region would not have met the target. For all of the communicable disease targets, even when overall progress was made, the situation for key vulnerable populations continues to be a challenge. Next slide, please. Goal 7 was to curb mortality due to violence, suicides, and accidents among adolescents and young adults. It was measured by the regional rates for homicide, suicide, and mortality due to road traffic injuries. We have some good news here, with the latter targets both exceeded. However, rather than seeing a reduction of 6% in the homicide rate, we saw it rise by 14%. Violence is, of course, a consequence of determinants across various sectors, and we are seeing high levels of income, wealth, and social inequality in the region. This often hits male adolescents and young populations particularly hard. Goal 8 was to eliminate priority communicable diseases in the region. Here, we see very mixed results, with the targets for elimination of onchocerciasis and malaria having been met, while the targets for elimination of mother-to-child transmission of HIV and congenital syphilis, Chagas, and dog-transmitted rabies were partially achieved. In some cases, we have seen difficulties with the process of certification of elimination, while in other cases, the gains are limited by insufficient investment. It is interesting to note here that although the regional situation with deaths due to malaria that I mentioned before is a cause for concern, some countries have made important progress with the elimination of malaria. Next slide, please. Finally, Goal 9, to prevent death, illness, and disability arising from emergencies, had just one target, which was to ensure that the crude mortality rate returns to baseline levels within 3 months for at least 70% of emergencies. This target has been difficult to measure. However, based on the Bureau's assessment of 16 qualifying events, the target was achieved. Next slide, please. The strategic plan was divided into 6 categories and 34 program areas. Categories were strategic areas of focus that were used to guide implementation of the plan, whereas program areas were the priorities that were identified by member states and which were equivalent to health outcomes. As this slide shows, 2 of the 6 categories and 13 of 34 program areas fully met expectations for the 18-19 biennium. I do recognize, by the way, that this chart is very difficult to read on the slide. However, it is contained within the report. Despite positive momentum in many areas, categories 1, 2, 3, and 4 partially met expectations. Next slide, please. To measure progress for the Strategic Plan 14-19 and the Program Budget 18-19, a set of outcome and output level indicators were developed. The assessment shows that 33% of the outcome indicators were exceeded or achieved by 2019, 44% were partially achieved, and 16% not achieved. At the output level for 18-19, 59% of the indicators were achieved, 34% partially, and 5% not at all. 7% of the outcome indicators and 2% of output indicators were not rated due to a lack of data. What this analysis suggests is that while the Bureau has effectively worked with member states in delivering results at the output level, the outcome level results require additional efforts to achieve the desired change. Next slide, please. At this time, I will move to a very brief overview of the budget implementation. The figure above shows the levels of approved, financed, and available funds or budget for the implementation, also referred to as funds available for each biennium. The dark blue is the approved budget ceiling contained in the program budget. The dark green is the amount financed, which includes all income that the organization considers in funding the program budget, even when some of these funds are meant to be used in future biennia, or when the corresponding cash has not been received in full. For example, this last aspect became very important at the end of the 1819 biennium with respect to the cash receipt of assessed contributions. So in this chart, the assessed contributions amounts that were billed to member states for the biennium are part of the financed bar, whereas actual receipts are part of the funds available, which is the light green bar. The funds available includes all types of funds that are distributed to entities and are ready for implementation or spending in the respective biennium. The yellow bar shows actual implementation, which includes all of the expenses incurred by the organization within the program budget. Of the total approved budgets across the 3 biennia totaling $1.9 billion, 94% was financed, 86% was available for implementation, and 83% was implemented. I would note that of the funds available for implementation, 97% were implemented over the 6 years. If the presenter could please click once, not moving to the next slide. Focusing in on 2018-19, which is the set of bars on the right. The program budget was financed at the level of $659 million. Again, this is from a budgetary, not a cash perspective. This high level of budgetary financing is explained by the accounting of the payment of the PAHO assessed contributions in full, as I mentioned before. This $659 million figure was in fact a record for PAHO, although of course the deficit in actual received assessed contribution payments meant that this did not translate into actual monies to be spent. Also, I would note that a good portion of the available funds was for non-base programs. The non-base programs are depicted in the lighter shade of coloring at the top of each bar. Thus, a total of $556 million was available for implementation in 2018-19. This allowed the Bureau to close 2019 with an implementation of $546 million, or 98% of the available funding, being 81% of the total approved budget. Next slide, please. This slide depicts base programs by program area. So each set of bars is one of the 6 program areas from left to right. And it shows the absolute and relative levels of financing varied greatly across the technical programs and across biennia. The approved levels of budget are represented by a small blue line, and the funds available for implementation are the green bars. The different shades represent the different biennia. For example, on the left, Category 1, communicable diseases, had an approved budget in 14-15 of around $100 million, and that was fully funded. The remaining bars, the somewhat darker shade of green, represent 16-17, and the darker green, 18-19. Program budget 14-15 had the highest availability of funds for base programs, as reflected in most categories. The following 2 biennia saw a reduction in the availability of funding. Program budget 18-19, on the other hand, saw the largest budget gaps in all categories. As indicated before, despite good overall financing, the increased funding was reflected more in special programs than in base programs. I will finish by noting that Category 2 and 3 are chronically underfunded versus the budgets. This is a historical situation that member states are aware of and has been discussed in previous governing body meetings. Categories 1, 4, and 5 were relatively well funded, and Category 6 saw reductions in both budget ceilings and available funding during the 6-year period. Next slide, please. Again, my intent is not for member states to be able to read this slide, but it contains some high-level messages. The graph presents the level of flexible funding for program areas, and these are stratified as per member state prioritization for 2018-19. Thus, the top of the graph presents the highest tier of priorities for member states, and the bottom graph the lowest tier. The reason that I show this graph is to show the relationship between these stratified priorities. The top tier has the lion's share of funding, in particular flexible funding, which is the dark green portion of each bar. And this is in keeping with member state prioritization. Nonetheless, given the limitations on flexible funding, the organization has not been able to close the financial gaps for all high priority areas, which you can see in the pink or light orange portion of each bar. This funding does remain a challenge for the future. Next slide, please. The Directing Council is invited to take note of this report and the accompanying Addendum 1 and provide any comments that it deems pertinent. Thank you, Mr. Chair.
Muchas gracias. Ahora, señor Chambliss, ahora le ofrezco el uso de la palabra al Pleno para iniciar el debate. Ha pedido la palabra México. Adelante, México.
Gracias, señor presidente. La delegación de México toma nota del informe presentado, mismo que constituye el informe final sobre la ejecución del Plan Estratégico de la OPS 2014-2019. La evaluación del desempeño es un proceso toral para la gestión basada en resultados, la cual debe guiar la labor de la OPS. La región dio un paso significativo al avanzar hacia un modelo de planeación de abajo hacia arriba y a un esquema de evaluación conjunta que permitía a los Estados miembros reafirmar el principio de apropiación, que es un pilar fundamental de la cooperación internacional. Notamos con preocupación un retroceso en su implementación al tomar el secretariado la decisión unilateral de no llevar a cabo la evaluación conjunta de indicadores y, en su lugar, publicar una evaluación.
Tenido una interferencia, por favor.
¿Ya?
Tenemos interferencia.
Vuelvo a comenzar el párrafo.
La traducción, tenemos una interferencia, por favor. Corregir. Hay un micrófono abierto en el área de traducción. Mónica.
Bien, retomo el párrafo en donde estaba, señor presidente.
Por favor.
Senhora, por favor, la idea sería, se me puedes colaborar desde su lado en primer lugar. Si vamos a la barra de herramientas en la base de la pantalla, habría que incluir...
Mónica, pensamos que no es ella. Pensamos que es en el área de traducción.
Claro, señor presidente. Hagamos paso a paso, se le parece, muy respetuosamente. Poner en mudo el audio original. Se puede poner en floor en los idiomas. Y mientras esto está hecho, mis colegas me están enviando WhatsApp. Me dicen que sigue abierto el micrófono del intérprete. Entonces, les agradecería a los colegas que me están colaborando con la plataforma.
I would hope that those who are helping me with the platform could shed some light on that aspect. Ms. Caballero of Mexico, let me give you the floor yet again, and thank you for your patience, and let's give it another shot. Thank you, certainly, says Mexico. I'll go where I stopped. We note with concern a slight step backward in that implementation when there was a unilateral decision of the Secretariat of not carrying out the joint evaluation of the indicator and publishing information on the basis of available data to the office. That's why we think this partial information leaves us with some gaps, and we don't have enough clarity here. One of the lessons learned from the joint evaluation process was to ensure that we could have a better understanding and that the Secretariat could have a better understanding on the basis of indicators that were the basis for the evaluation that was subjected, and to facilitate documents that have been presented. We would have appreciated the Secretariat to allow the Executive Committee the opportunity to express its view that there be a vertical approach that would have allowed member states to allow their own mechanism for assessing the achievements of the organization, particularly in this exceptional period we are traversing. We thank the managing director for her support and for accepting guidance by the directing bodies, in as much as we're basing ourselves on technical expedience and efficiency. This is something that the external auditor has called for, so that we have a strategic focus on the management of the organization to better assess its efficiency. This is what we hope we can do jointly. Thank you. Thank you. I offer the floor to Honduras. Thank you, Mr. Chairman. Honduras agrees with the evaluation report for the end of biennium assessment, I should say, of the PAHO program and budget 2018-2019, and the final report on the implementation of the PAHO strategic plan 2014-2019, inasmuch as these are support instruments that allow us to have a better sense of what has actually been achieved, and to allow us to assess the challenges that we had before us before the pandemic, which of course have to be seen again in the current context, bearing in mind all of the social, economic, and epidemiological factors that are involved both regionally and individually, country by country. This is important for us to have a good sense of where we stand and lessons learned in each of the categories that are presented in this report offers, we believe, a valuable opportunity to really assess where we stand and to avoid making mistakes from here on in. This assessment does show clearly the significant progress that countries have made on the basis of technical cooperation that the Pan American Sanitary Bureau has offered over the 18 and 19 period, and Honduras certainly was able to look at maternal mortality and the integral approach to the determinants of health through indigenous communities and other populations. That said, there are considerable gaps as regards the brunt of the pandemic, and this is happening, as we know, regionally. If we look at the 2025 strategic plan for PAHO, we understand that we've got to double down and do better in terms of the sustainable development goals and health in particular for the year 2030. We hope that we are offering you some valuable insight, and you can take whatever you consider of particular pertinence. Thank you so much. Canada now has the floor.
The region. While not all of the impact targets were achieved, Canada commends the region for the significant progress that has been made, such as reductions in infant mortality and maternal mortality, the elimination of mother-to-child transmission of HIV and congenital syphilis, and expanded vaccine coverage. While there is much to celebrate, significant health challenges remain, like the mortality due to chronic diseases, and it is important as we move forward to scale up efforts in areas that are lagging, recognizing the pressures we face with COVID-19. We also note that there has been insufficient progress on addressing inequalities in health, that vulnerable and marginalized populations continue to face access barriers. We must sustain regional efforts to address the social, cultural, and gender barriers that limit equitable access and addressing the issue of violence against women and girls. This is particularly important if we want to implement a comprehensive response to COVID-19. We recognize that PAHO's financial situation has impacted programmatic activities, has made their ability to respond to the needs of member states that much more challenging, particularly in the last biennium. In closing, we need to reflect on lessons learned and at this time focus our attention on protecting health gains, particularly in the situation we are all in with COVID-19. As we look forward, the strategic plan is indeed the key instrument that will guide our work in the coming years. However, there is a degree of uncertainty on the road ahead. As such, we believe it is important to have flexibility in its implementation, relying on the director's leadership so that we are able to respond effectively to the evolving challenges of COVID-19. Thank you.
Muchas gracias a Canadá. Le pedimos al señor Chambly, le damos la palabra para responder comentarios.
Thank you very much, Mr. President, and thank you to the member states for those interventions. I would start by noting, I think it's very important that this be clear, that the decision regarding the joint assessment process for the 2018-19 biennium, the decision not to proceed with that was not certainly not a unilateral secretariat or a bureau decision. In fact, the Secretariat launched the process at the beginning of this year, as per usual. However, in view of the evolving COVID crisis, we had an overwhelming response from our member states that they would be unable to complete the exercise this year. And given that there's a high level of completion or percentage of completion that's required in order for the exercise to be valid, it was simply not feasible for the exercise to be carried out for 2018-19. I certainly appreciate the other comments that were received, particularly the emphasis on the link to the Sustainable Development Goals, which is certainly applicable in the Sustainable Health Agenda and especially in the new Strategic Plan 2025, and the importance of flexibility in implementing that plan and the protection of the health gains, which of course, some of the statistics that I presented in terms of the impact indicators are very much in jeopardy right now during the COVID period and will require redoubled efforts on the part of both the Secretariat and of course member states in order to ensure that we do not slip backwards in those. Thank you very much, Mr. President.
Muchas gracias al señor Chambly. Señora directora, ¿desea hacer algún comentario?
Gracias, señor presidente. I do regret the late timing of the consideration of this agenda item. I think this is an important agenda item that reflects the work of not only the Secretariat, but that the work of the entire organization, meaning our member states with the Secretariat. I just want to reiterate the comments of Mr. Chambliss that it was not a Secretariat's decision not to do the joint assessments. In fact, we are the first region that started doing joint assessments. It was not because member states asked us to do it. We suggested it to member states because we are so committed to doing this work together and to jointly being able to determine where we are in relation to the goals that we've set ourselves. It is clear, therefore, that we will need to pay some serious attention to the targets that we've set ourselves, given the COVID-19 challenge, given the other challenges that member states will face in terms of their own economies, that we will need to revisit how can we reach those targets? How can we work in more effective and efficient manner to meet the needs of all of our populations, and in particular to meet those targets that we set ourselves? I do believe that it's going to be important, first of all, with the working group that you suggested in terms of revisiting where it is that what are some of the adjustments that we probably need to make to our priorities? How do we adjust technical cooperation so we can meet the targets under these priorities? And the Secretariat has already begun to examine each of our priority areas and what has been the effect of COVID-19 on those areas. And all of that information will be fed into the planning process for the 22-23 budget. So thank you very much. It is together that we can achieve, and we fully recognize the supremacy of member states and certainly their sovereignty, and we are committed to working with member states to achieve our targets. Thank you very much.
Muchas gracias a la directora. Informo al Consejo que el debate constará en el informe final. Pasaremos a considerar el siguiente punto, 7.1, aplicación del Reglamento Sanitario Internacional. Señalo la atención del Consejo el documento CD 58 INF1 e invito al doctor Ciro Ugarte, director del Departamento de Emergencia de Salud, a que presente el punto. Doctor Ugarte, tiene usted la palabra.
Muchísimas gracias, señor presidente. Voy a hacer una introducción breve con una presentación en PowerPoint. Debido al tiempo, voy a pasar rápidamente algunos de los slides, pero es importante señalar que la siguiente, por favor. Este punto tiene altísima relevancia, no solo por el COVID-19, por la COVID-19, sino también por otras emergencias de salud pública y por otros eventos que están ocurriendo en el mundo, y vamos a analizar esos puntos. La siguiente, por favor. Aquí está cuál es la estructura del documento. Está enfocado en la aplicación, en la implementación y en el cumplimiento del Reglamento Sanitario Internacional, y cubre el periodo de 1 de julio del 19 al 30 de junio de este año, y complementa el documento presentado a la Asamblea Mundial de la Salud de este año y el documento que está presentado, el 58/6 de COVID-19. Quisiera mencionar que la parte de la situación, del análisis de situación, incluye varios aspectos, acciones necesarias para mejorar la situación y acciones que el Consejo Directivo se espera que tome. La siguiente, por favor. Respecto al análisis de situación, quisiera mencionar que hay 3 eventos de salud pública de importancia internacional: el poliovirus salvaje y también el poliovirus derivado de la circulación de la vacuna, la enfermedad del ébola, que está discontinuada a partir del 26 de junio, como emergencia de salud pública de importancia internacional, y la COVID-19 determinada el 30 de enero de este año como emergencia de salud pública y caracterizada como pandemia el 11 de marzo por el director general de la OMS. En las Américas, quisiera mencionar que el 25% de todos los eventos analizados a nivel global provienen de las Américas, y un punto importante: 59% de esos eventos que se han reportado provienen de los Estados miembros, y 29 de ellos, de esos 44, provienen de los puntos focales o los centros nacionales de enlace. Y hay eventos que están relacionados, que se han sustanciado como, sustentado como emergencias o como situaciones que pudieran generar un evento de salud pública internacional que corresponde al 21% del nivel del total global. La siguiente. Esto es el gráfico de los reportes anuales presentados por los Estados miembros. Quiero resaltar 3 puntos, que la región de las Américas en todos los 13 capacidades está por encima del promedio global. Sin embargo, tenemos un nivel muy bajo en temas de radiación o emergencias radiológicas y el nivel más alto de la región está en laboratorio, donde tenemos 79% de promedio en la región. La siguiente. Aspectos que requieren, aspectos administrativos y de gobernanza, el marco de monitoreo y evaluación del reglamento tiene un componente mandatorio, que es el reporte anual, y tiene componentes voluntarios. En cada uno de esos se han hecho trabajos a través del secretariado, y también ahí vemos algunos de los elementos principales, por ejemplo, la actualización o la confirmación de los centros nacionales de enlace y los usuarios en la plataforma de eventos del Reglamento Sanitario Internacional. Y hay otros elementos adicionales que van a quedar como información para ustedes. La siguiente, por favor. Es importantísimo, y a partir de aquí quisiera resaltar algunos puntos importantes. La COVID-19, la pandemia de COVID-19, es el arquetipo para el cual se desarrolló, se implementó, se aprobó el Reglamento Sanitario Internacional. Y ha puesto la aplicación de cada uno de los componentes del reglamento sanitario y provisiones del reglamento sanitario internacional se han puesto a prueba. Y quisiera resaltar algunos aspectos que son parte de la respuesta nacional que antes no eran visibles. Sin embargo, es una oportunidad para asegurar una inversión sostenida en salud, pero también para mejorar la confianza en la aplicación del Reglamento Sanitario Internacional a nivel de nuestros países. La siguiente. También quisiera resaltar que hay elementos que se están desarrollando como en función del artículo 54, donde la Asamblea Mundial de la Salud puede periódicamente revisar el funcionamiento del Reglamento Sanitario Internacional y a través y puede requerir o puede pedir el asesoramiento del comité de revisión. Y aquí vemos algunos elementos. 2 de esas recomendaciones fueron adoptadas por la Asamblea y otra no fue adoptada, pero fue, bueno, se adoptó una decisión 2 años después. Y hay consultas formales del Reglamento Sanitario Internacional que se han hecho en nuestra región y también finalmente una consulta global el 2018. La siguiente. Quisiera mencionar que cada uno de estos aspectos que ustedes van a ver son dificultades, son problemas, son retos que están señalados en el documento, donde también se proponen algunos ajustes. Y entonces está respecto a la información que los Estados miembros comparten con el secretariado de la OMS durante los eventos, la información que el secretariado comparte con los estados parte, y también aspectos que están relacionados con las recomendaciones temporales que se terminan luego de una emergencia de salud pública de importancia internacional. Y hay otros elementos que ustedes ven ahí relacionados, y quisiera mencionar que cada uno de esos puntos están detallados en el documento, y quisiera resaltar otros puntos adicionales. La siguiente. Es que hay oportunidades para los estados parte del reglamento.
Very much focuses on the opportunities for states parties to steer the international health regulations application, implementation, and compliance with the regulation, the IHR. As to the codes that undergird its application, and here I refer to the resolution that the World Health Assembly passed That was the convened evoking resolution WHA 73.1 and the review committee that looked at responses, the independent panel for pandemic preparedness and response, the IPPR. But in addition to that, there are analyses, there's a sharing of opinions, and the independent panel for pandemic preparedness and response of WHO, which I just mentioned, is one. You also have the independent oversight and advisory committee for health emergencies, the strategic and technical advisory group for infectious hazards, and the interagency group that includes WHO and a number of other international bodies. That's the Global Preparedness Monitoring Board. In taking all of this into account, we would wish to invite the Directing Council to take note of this report, and if they consider it pertinent, for member states to provide any comments. This document, I say again, sets forth a plethora of details and aspects and details that are of interest. And let me simply underscore the opportunity that states parties are given to implement these or to modify them if they consider that opportune. Thank you, Dr. Ugarte. We hope to complete our agenda today, and I want very much indeed to thank the interpreters who have been working with us since 8 a.m. Without their support, their very hard work over the course of today, it would have been impossible for us to move steadily through these negotiations in the context of our Directing Council. The chair kindly says, offering the floor to the plenary for any comments. Mexico has the floor.
Thank you very much, President. The international health regulations is a binding instrument to be respected by all member states. Its raison d'etre is to avoid the propagation internationally of public health emergencies and to control the preparedness when it does occur and to give a public health response to a public health problem. Furthermore, another issue is to avoid the unnecessary interference with international trade and transit. In the current pandemic, one of the chief measures taken that Mexico did not adhere to is the closure of borders, resulting in potential stigmatization of people given their ethnic origin, such as occurred in 2009 in the influenza pandemic. And we believe this runs counter to what is set forth in the regulations themselves. Other political responses have also been given to a public health issue. In Mexico, we've attempted to technically address this problem. We invited the organization to taste this experience to improve processes, including communication with member states and when communicating risks. And as has often been pointed out by the committee, we need to strengthen the basic capabilities as a continuing process and not simply a review of lists. We must also go towards a world better prepared for the future pandemic that will find us better organized nationally and internationally, because although we don't know when, we do know that there will be a future pandemic. Mexico believes COVID-19 has put us in a position to review the 2005 IHR to have a better response to the world post-COVID, to have technological smartness instead of simply counting cases, supposing that each and every one of the afflicted persons is being counted when we know that is impossible. So Mexico recognizes the sentinel surveillance and to use intelligence to know about these pandemics. We know that the cases have been underestimated. Lastly, we call upon the Secretariat of PAHO so that, as regional office of WHO, it be the spokesperson for its members for the potential review of the regulations and support national authorities should there be a possible change, and support us to monitor and evaluate. Your time is up, said the President. so that member states can present evidence about the challenges to implement the regulations and to evaluate the impact of the pandemic. Thank you very much. Thank you, Mexico. Argentina is recognized. Thank you, President. Argentina notes the report. We want to reaffirm the country's application of IHR to guarantee its full integration in the health system. Argentina recognizes that transparency in developing basic response and surveillance tools is essential to implement the regulations. We present our annual report, we make the voluntary external review, and we are working on the plan of action. As the document says, the COVID pandemic has put to the test practically all the provisions of the regulations, and we think that the committee to review IHR will look at mandatory implication of these regulations. Argentina has always supported this as being a bounding document. We want also to join working groups, and that is why we'd like to know what are the procedures used to include experts designated by the countries, in particular those proposed for the emergency committee of the IHR. We also think that the review on institutional position to achieve necessary knowledge between technical information and decision-making level, and ensure that the actions are carried out in the implementation of national emergency actions. Argentina thanks PAHO for organizing the event for restoring travel, air travel, and we, in particular, would like to take into account the requirements imposed on passengers entering and exiting countries. Thank you, Argentina. United States is now recognized. United States,
Thank you, Mr. President. As member states throughout our region continue to respond to the COVID-19 pandemic, fully meeting our obligations under the IHR remains essential to ensuring the region effectively addresses this threat and remains vigilant in preparing for and responding to other new and emerging threats. Failure to fully implement the IHR
Now, yes, it seems to be going through. So if the United States doesn't mind starting again, please.
Of course, Mr. President, we'd be happy to. As member states throughout our region continue to respond to the COVID-19 pandemic, fully meeting our obligations under the IHR 2005 remains essential to ensuring the region effectively addresses this threat and remains vigilant in preparing for and responding to other new and emerging threats. Failure to fully implement the IHR 2005 have grave health, social, and economic impacts, as were made abundantly clear with COVID-19. Drawing on the evolving lessons of the COVID-19 pandemic, we believe there are strong actions WHO and member states can take related to the IHR, including reinforcing the WHO and member states' role in advancing member state IHR implementation and compliance. Therefore, the United States offers a WHO roadmap reviewing COVID-19 response and strengthening WHO's global emergency preparedness and response. The roadmap outlines where the United States believes there are opportunities to strengthen the WHO by increasing its accountability, transparency, and overall effectiveness to address new and emerging threats. The roadmap has been widely with member states, as well as the WHO Director General, the IPPR Secretariat, the Independent Review Panel, and we hope to discuss opportunities to strengthen WHO at the upcoming special session of the WHO Executive Board next week. We believe that PAHO and member states of the Americas region can play a critical role in these efforts. The United States believes that necessary reforms within the WHO will ultimately strengthen global preparedness and response efforts so improvements can be applied to the current pandemic as well as any future pandemics. We also think a universal review mechanism to track member state implementation and compliance with the IHR may help incentivize both implementation and identification of areas for improved technical assistance. Thank you.
Thank you, United States. Honduras is now recognized. Thank you, President. Honduras agrees with the report that has been issued on implementation of the IHR. There is no doubt that it's important to have technical and financial cooperation from PAHO WHO to strengthen the response capacity of countries in any international interest health emergency through implementation of the 13 capacities in the IHR. Nonetheless, Dr. Tedros, Dr. Etienne, one must take into account the major differences and capacities that exist among states when it comes to implementation of the international health regulations. We must leave aside the concept of a national plan devoted to the IHR as the single model for all. The COVID-19 pandemic is a clear example of a public health event with international implication that seems to put to test the implementation of practically each and every one of the provisions in the IHR. Applications that were conceived for collective management of events such as this. More than ever before, it is essential to analyze in depth and to adopt measures to guarantee through an IHR that has been strengthened to provide more fair tackling in the emergence of an emergency. Joint work with states, giving priority to those countries with most serious health and economic problems. Thank you. Thank you, Minister. Colombia is now recognized. Thank you, President. We are grateful to the Secretariat for presenting the report on implementation of the international health regulations, and we take this opportunity to underscore that the IHR is one of the vital instruments of our organization because its implementation, monitoring, and following through are tasks to be prioritized. Nonetheless, we note with concern that the concern about implementation of IHR presented by PAHO WHO in recent years mention about deficiencies in response and reporting by some countries. They are low indices in verification of cases verified throughout the region. We'd like to therefore underline the need for the countries in the Americas to maintain basic capacities for surveillance and response in public health, while also the need for PAHO to continue providing technical assistance to countries in the matter, as well as verification of data generated so that we may be certain about the correctness of the information so that timely measures may be adopted. We know firsthand the problems that epidemiological sciences may cause to national and international efforts when attempting to prevent and control public health events. So we invite states to redouble efforts to implement IHR and give priority to transparent, continuing work to control risks coming from these public health matters of interest. Lastly, Mr. President, the external voluntary evaluation and implementation of IHR is a challenge for the region. A better understanding of this evaluation is needed. Therefore, we encourage the organization to continue supporting the task so that more countries may voluntarily implement this valuable tool. Thank you very much, Mr. President. Thank you, sir. Canada is now recognized. Go ahead, Canada, please.
You cannot start
your video. Oh, okay, j'ai un problème. Il dit que je peux pas partir
Sorry,
mon video.
we cannot start the video, President. Okay. Okay.
Oh.
Okay. Thank you very much. Canada would like as the challenges faced in the region. We would like to commend PAHO and member states for their efforts to respond to the COVID-19 pandemic, including the timely sharing of information, epidemiological alerts, and updates. Canada acknowledges the key role that PAHO plays in responding to regional health challenges and emergencies, and considers the continuity of PAHO's operations to be essential, particularly during this critical time. Canada recognizes the challenges facing many countries in meeting their core capacity requirements and implementing the IHR, and fully supports collaborative approaches to strengthen global health security. COVID-19 has put the IHR to the test and has highlighted many aspects of the response which had not been highly visible before, that we must reflect on as we consider how to strengthen future responses. These issues should be addressed in any review process that takes place, and in this regard, we look forward to engaging in the work of the Independent Panel for Pandemic Preparedness and Response and the IHR Review Committee. Le Canada appuie les efforts mondiaux et régionaux visant à donner la priorité à la mise en œuvre du règlement sanitaire international et à renforcer la capacité de l'organisation d'appuyer ses États membres par le biais de diverses initiatives visant à renforcer les systèmes de santé. Nous continuons d'appuyer le partage d'informations de santé publique en temps opportun, précises et suffisamment détaillées relatives à la pandémie de COVID-19 entre les États membres et l'OPS, l'OMS, et entre les États membres conformément au RSI. Merci, Monsieur le Président.
Thank you very much. Canada, Brazil is now recognized. Thank you, Mr. President. As I have said before, the response to by Brazil to the pandemic has shown that Brazil immediately reported to the WHO when it had a case. We provided an exchange and share information with the member states in the general reaction to the pandemic. This is an internationally important public health challenge, and we have learned lessons from the pandemic. Brazil believes that more than ever, it's essential to implement IHR, and we hope to include improvements. We support the proposal, the US proposal to have some improvements on the short and long-term application and implementation of the mechanism. We know that the closing of borders has slowed down the flow of and movement of passengers between our countries, but measures need to be in accordance with Article 2 of the regulations so as to not complicate public health risks. The global response to COVID-19 are essential to build a more robust global action. And the instrument already has very important provisions, and there are lessons learned. Looking at parallel alternatives, we believe will strengthen the regulations itself, as well as its implementation by member states, and ensure its enforcement by all countries. We need to provide support to those countries who need to strengthen their capabilities. Brazil has tried to improve its core responsibilities and capacities because we want to have a surveillance network. The network is already present in all Brazilian states. It's a scale up. We'll be implementing another large number of centers, and especially in the agricultural area, because we want to ensure coverage. We are installing centers in 20 borders. The president interrupts. Time is up. Thank you, President. Just 10 more seconds. The capacity in Brazil will encourage having new spaces for dialogue and cooperation with neighboring countries. The response by Brazil to COVID-19 has shown that it's important to provide a rapid response to these emergencies. The country continues open to dialogue and cooperation and will promote health in the region. We have had successful experiences for gradual reopening of borders and border crossings so that there is a crossing of people and goods nowadays, and we want to promote collective health. Thank you very much, Mr. President. Thank you very much, Brazil. Cuba is now recognized. Thank you, President. We believe that the international health regulations are a valuable instrument to tackle and respond to the pandemic. Nonetheless, based on our own experience and the work that has been carried out, we believe it is important to note some actions for its implementation and application by some of the member states, as some of the coordinated actions to strengthen multilateral cooperation to tackle pandemics or events that could become an internationally important public health event. Mechanisms to regulate the situation of foreigners when declaring the public health event or a pandemic. Policies focusing on vulnerable population and that other areas be considered having to do with international access to medicines, vaccines, health systems, legal frameworks, and other related sectors, intersectoral actions, and response measures in the economic and social ambits. The international health regulations is the most important legal instrument to ensure global public health insofar as the recommendations are properly implemented. Its relevance will increase for global governance with evident outcomes in the health of our populations. Thank you very much. Thank you very much, Vice Minister. The United Kingdom is now recognized.
Thank you. And thank you to PAHO for the comprehensive update paper. The UK supports universal implementation of the IHR as essential to protect all people of the world from global health threats and the international spread of disease. The UK supports WHO in its primary leadership and coordination role in ensuring that all member states fully implement the IHR, but can only do so within the mandate granted to them by member states. The current pandemic highlights the need to review the response, including the IHR, to look at how the world can be better prepared to prevent, detect, and respond to this and future outbreaks. We would be happy to consider how we evaluate compliance with the IHR and how that translates into member states' demonstration of preparedness to respond to health threats, but are keen to ensure it builds on the strong foundations of the IHR monitoring and evaluation framework. We support continued dialogue on the introduction of intermediate level or levels of public health alerts as a means to encourage member states to raise concerns and prepare for outbreaks earlier. We are also supportive of looking at what more can be done on early warning more generally, including considering agreed actions and timelines for different stages of an outbreak. We look forward to engaging with the IPPR, IOAC, and IHR Review Committee over the course of their work, running until the May World Health Assembly next year. Thank you.
Thank you very much, United Kingdom. I now offer the floor to Mr. Ugarte, should he wish to respond to the comments. Thank you, Mr. President. I just want to underscore that in this joint effort, most countries shared timely information. There are challenges, obviously, when it comes to delays, and also sharing information that is sufficient for an analysis. I'd like to respond to the question posed by Argentina about the criteria for selection of experts to the IHR committee. The Committee of Experts members represent 10 countries in the region. So the member states are the ones who should nominate or propose experts. And the document points out that at several consultation meetings in the region, a request has been made to the Secretariat of the International Health Regulations to explain the procedures in order to include or exclude experts. The selection process is a matter that has been under discussion now for several years. And with regards to the update or review of the IHR, in the presentation and the document, you'll find a number of mechanisms allowing countries to interact. One of the aspects that perhaps some member states would like to share is how the countries in our region could agree on certain procedures or certain recommendations that will help the process and the information sharing with the Secretariat to be able to demonstrate the progress made. We are in continuous dialogue and coordination with WHO Secretariat to improve the procedures. And I do believe it's important for member states, or members party rather, bear in mind that those changes need to be made on a global basis. So these are the aspects that need to be worked on further. Thank you. Thank you, Mr. Ugarte. Madam Director, do you have any comments?
Thank you, Mr. President. This agenda item is usually one of significant interest, that generates significant interest by all of our member states and member state parties. IHR, the value of IHR has been clearly recognized during COVID-19. And the deficiencies in its implementation has been clearly demonstrated in COVID-19. And there is now a clearly stated need for further assessments, evaluations by state members, and certainly a review of the IHR itself. Let me say that the Secretariat will continue to work with our member states to strengthen their core capacities, the overall implementation of the IHR. We will continue to work with member state parties of this region to pull together their suggestions, recommendations to the review committee, but also to WHO. This region has consistently made suggestions and recommendations for enhancing the implementation of IHR. And we will continue to champion those, and we ask member states to get involved in the discussions around the IHR so that your own experiences can be brought to bear on the review of IHR. Thank you very much.
Thank you very much, Madam Director. I would like to inform the Council that the discussions will be noted in the final report. Let us have a 5-minute break. It is now 5:56 Eastern Standard Time, so we will reconvene at 6:01.
Continuamos, por favor. Bueno, muy bien. Vamos para el punto 4.2.
We're going to pick up 4.2, the COVID pandemic in the region of the Americas. Now, ladies and gentlemen, we've already heard the presentation here, and we were on the presentation of the rapporteur on the draft resolution, and we ask for the rapporteur to kindly read out the resolution that we have for COVID-19 pandemic in the region of the Americas. Mr. Chairman, the rapporteur is very far away from his microphone. The interpreter is having a lot of trouble hearing him. If he could please get closer. Going to do our best. We are looking at COVID-19 pandemic in the region of the Americas. This is document 58/6. This document has been previously distributed on the basis of the work carried out in the informal group. There are amendments to the original, and we would ask to be authorized to read out the amendments to the original proposed resolution. If you and the Directing Council accepts this, we would put it to you simply for adoption, given the lateness of the hour. If you, sir, or the plenary wish to handle this differently, I'm in your hands. The chair, I couldn't agree more. If any delegation or delegations feel differently, please let us know, speak up. But otherwise, I would agree with the request, which is that we only read out the part of this proposed resolution that has been modified. In the absence of any objection, that's what we will do. This is the proposed resolution, COVID-19 pandemic in the region of the Americas, the 58th Directing Council. And now we're moving right down in the considering section. And we're going to read out what has been added. Under 1, 2, and 3, we're in the original document. No change to PP1, PP2, or PP3. We now move to PP3 bis, which reads as follows. Recalling World Health Assembly Resolution WHA 73.1 on the response to the COVID-19 pandemic, and in particular, the call in the spirit of unity and solidarity to intensify cooperation and collaboration at all levels in order to contain and control the COVID-19 pandemic and mitigate its impact. PP3 TER, recognizing the role of extensive immunization against COVID-19 as a global public good for health in preventing, containing, and stopping transmission in order to bring the pandemic to an end once safe, quality, efficacious, effective, accessible, and affordable vaccines are available. PP4, ladies and gentlemen, stands as in the original version. We now move to the resolves. Resolves. And under OP1, there is an amendment to point out under G, OP1G, because A through F stand without any change. G then goes on to say, provide sustainable funding to the Pan American Health Organization so that it can fulfill its mandates while responding to mitigating the impact of and recovering from the COVID-19 pandemic, considering the economic impact of the COVID-19 pandemic in developing member states. Two, to request the director to, this is OP2, under A, B, C, D, and E, there is no change. The first change comes in, and I will read where changes do occur. First, E bis, continue to develop actions and tools that promote international cooperation in the framework of Resolution CD 52.R15, Cooperation for Health Development in the Americas, to respond to the COVID-19 pandemic in the region of the Americas. F, provide support to member states in the framework of the IHR and in coordination with the World Health Organization through the development and publication of regional guidelines and recommendations on the management of international travels, especially the effectiveness of traveler screening tools, among others, in order to allow member states to undertake the corresponding risk management activities. Now, the next set of paragraphs are the original without change. The only thing that is changing is the designation. They are now G, H, I, and J. And Mr. Chairman, that's it. That's the end of this amended proposed resolution. This has been circulated, says the chair, that has been distributed, circulated in the 4 languages of the organization. It's been transmitted throughout the day. So I believe the time has come to open the debate. The United States has the floor. You have the floor, ma'am. U.S.
Thank you, Mr. President. We take the floor to support the great work that was done on the COVID resolution. We would only note that with respect to the resolution in OP2, paragraph D, where it says support member states through the Bureau's technical areas. In the 3rd line, it says to improve equitable access to and appropriate use of affordable, safe, efficacious, and quality vaccines. We would just note and raise that we would ask after to improve equitable access to, we would add the words without undermining incentives for innovation. This was an oversight on our part. We apologize for that. But we would propose that language in D, only that language, and could accept the rest of the resolution and support it. So we would ask for support from the PAHO member states to add that language. We can send it to you right now. And we ask for PAHO state support. Thank you.
Pediríamos a los Estados Unidos que por
We
favor
would ask the United States to be so kind as to read out again the amendment that you're suggesting. Kindly read out what you just said. Thank you.
Thank you, Mr. President. Yes. OP2, subparagraph D, support member states through the Bureau's technical areas, the revolving fund for access to vaccines, and the regional revolving fund for strategic public health supplies. To improve equitable access to, without undermining incentives for innovation, and appropriate use of affordable, safe, efficacious, and quality vaccines. So our amendment says to improve equitable access to, without undermining incentives for innovation, and appropriate use of, We can send it to you in writing as well.
Por favor.
Yes, please do. Please do. Thank you. Are there any other questions or comments or concerns?
Preguntaría entonces en este punto y ahora si
I would then ask whether there is any objection to the proposed amendment by the United States.
Muy bien. Entonces, dado eso,
There appear to be no objections, and given that,
dado que no hay ninguna otra presentación, ninguna otra objeción,
and is as much as there's no other comment, I declare this proposed resolution hereby approved.
pasaríamos al siguiente punto, que es el
Let us move on then to the next item. That's next item is other business, other matters, I should say. Madam Director, what other matters might you have to put before us in this directing council? You have the floor.
None I can think of, Mr. President, except for some closing remarks.
Por favor, adelante con sus comentarios finales, señor Eric.
Please do go ahead with those final remarks. Go right ahead.
Thank you, Mr. President. And let me also greet all of our representatives of member states, and if we have other ministers of health present with us at this time. So I hope for you that it is, for me, it is with a deep sense of satisfaction that we move to the closure of this 58th session of the Directing Council of the Pan American Health Organization. I believe that we've come to an end of a highly productive and engaging two-day meeting, during which we successfully navigated 22 agenda items and approved 9 resolutions. On behalf of the entire Secretariat and on my own behalf, I wish to extend my sincerest thanks and my heartfelt appreciation to all of you for your individual and collective contributions to ensuring that we successfully completed this required tasks as defined by the agenda. When you, our member states, provide critical analysis of our proposals and evidence-based guidance and direction to the Secretariat, with that level of dedication and thoroughness that you displayed, you are ensuring both the continued quality and the relevance of PAHO's technical cooperation programs, both now, but well into the future. I was heartened to hear that those fundamental principles of saving lives, improving the health and well-being of our populations, and enhancing the health security of member states and of our region, those that were the impetus for the formation of PAHO 118 years ago are still highly relevant now and very applicable in this technologically advanced 21st century. And indeed, as we grapple with this COVID-19 pandemic. The rich discussions regarding the responses of member states, as well as the secretariats to the COVID-19 pandemic, have demonstrated collective leadership, solidarity, and determination. It has identified gaps which can be transformed into opportunities, such as reducing inequities in health and improving access to the social determinants of health, reinvigorating our efforts in the fight against NCD, advancing progress on universal health with an emphasis on the first level of care, investing in building resilient health systems, and working assiduously to reduce the burden and health impacts of climate change, to name a few. To have survived well for over a century speaks to resilience and adaptive innovations, not only in our technical cooperation, but also in our governance and in our financial and risk management. Clearly, changes and adaptations, even transformations, were essential for PAHO keeping abreast with new developments in a rapidly evolving, a highly interconnected world, without compromising or diminishing our fundamental values and our guiding principles. So I would like to reiterate my personal commitment, as well as that of the executive management team, to continue to purposefully build transparency, accountability, and risk management across all of PAHO's operations in order to survive and thrive during this century. I take this opportunity to congratulate member states on your efforts around discussion to strengthen member state oversight, including reinforcing risk management practices with the approval of PAHO governance reform. I greatly appreciate the expressions of commitment that we heard, and once again, I wish to record my sincerest thanks to all member states that have fully paid their assessed contribution. And to those with outstanding assessed contributions, your early remittances are vital and critically needed at this difficult moment. We cannot allow the organization to be constrained in its ability to effectively respond to the COVID-19 pandemic, as well as the other high priority public health programs because of lack of funding. In closing, and on behalf of all of us, I would like to convey our special thanks and our deep appreciation to our President, Honorable Fernando Ruiz Gomez, Minister of Health and Social Protection of Colombia, for his steady hand and skillful management of this 58th Directing Council. I would also like to express our sincerest gratitude to the Minister of Health of Barbados, the President of the Executive Committee, as well as to our rapporteur, who all discharged their respective functions with diligence and excellence. I would also record our thanks to all of our member states who made the effort to participate in this Directing Council. Let me also record our genuine and collective thanks to our own Deputy Director, Ms. Marilu Valdez, for her dedicated and seemingly effortlessly gracious work as Secretary of this Directing Council. To our Governing Body's Office for the efficient planning, management, and execution of all matters related to this, our first virtual Directing Council meeting. To the staff of our departments of Communications and Information Technology for all of their dynamic support with enabling effective and uninterrupted connectivity. We had 400 participants who were connected to the Zoom platform. We've had more than 5,000 participants through live streaming. To all of our staff at the Secretariat for their tireless efforts, their sterling contributions, and magnanimous support, both during and prior to this week's meeting, my heartfelt thanks. And finally, on behalf of all of the delegates, I would like to extend a wholehearted thank you to our talented interpreters, our interpreters who have lasted so many hours on this, the second day. You have been able to conduct your work in an efficient, dedicated, and seamless manner. So once again, I want to congratulate and thank all of us for a job well done. And I do look forward to your continued unstinting support, your active engagement, and unwavering solidarity with the Pan American Sanitary Bureau as we continue to work to save lives, to improve the health and well-being of all peoples, while fighting this monumental battle against this minuscule COVID-19 virus. And we will overcome. At this moment, I would like to make a presentation to the President of our Directing Council. Sir, it is usual that we give you a hammer that you will remember you're serving as President of the Directing Council. And I will ask my PWR or representative in Colombia to make that presentation to you now. And thank you all very much, and we'll see you soon.
Muchas gracias, señora directora.
I thank you very much, Madam Director. I wasn't expecting my first gavel. Thank you.
Let's see.
Let me thank you. Here we go. You see? There it is. I think I'm going to have to hide it from my little daughter when I get home.
Estados Unidos está pidiendo la palabra. Adelante.
United States is asking for the floor. You have it. U.S.?
Mr. President, on behalf of the United States, we just wanted to thank you for your strong leadership of this Directing Council and the strong leadership of Dr. Etienne and Deputy Director Lou Valdez. This has been an extremely challenging Directing Council on a virtual platform, and we really appreciate the great leadership you've demonstrated. So thank you.
Muchas gracias. ¿Alguien más quiere hacer uso de la
I
palabra?
thank you for that. Would anyone else like to take the floor? Colombia?
Adelante, Colombia.
Colombia, you have the floor. Thank you. Thank you, Mr. President. I want to join in the congratulations to you for your leadership and my thanks for your sterling leadership. To have someone of your high caliber leading us, leading all of the countries of the Americas is a signal honor for us. Thank you, dear Mr. President. Thank you. This has been a memorable directing council, and thank you so much for guiding us through it. Thank you. Thank you, Colombia. Mexico has the floor.
Gracias, señor presidente.
Thank you very much, Mr. President. We in Mexico also congratulate you for your leadership of this very first virtual directing council. This is historic. There's no other adjective that will suit. This is a first because of the situation we're living, but also because thanks to you and for the manner in which you led us through this, we really felt very close despite the time zones that separate us and innumerable technical difficulties needless to say, but you and your great team and those behind you have ensured that this directing council has been smooth and productive. We send you a big hug and warm congratulations. Thank you very much, Mexico. And to quote you, let me say for my part that this virtual session, quite frankly, was a huge challenge, no question. And I think this does show us uncharted territory. And it's proof that we human beings have got to get used to the new norm, as humanity has repeatedly through its history. And indeed, as we ourselves are doing in this very recent history, it is our time to live. Let me most especially extend enormous appreciation to Dr. Carissa Etienne for her availability, for the entire Secretariat, for Monica Zakdeliev, who has devoted so much of her efforts and time, allowing us to hone very closely, very strictly to the program, and her entire team. And again, very special thanks, the President kindly says, to our interpreters who have done yeoman's job and bending over backwards for us to be able to close pretty nearly 10 hours after we stopped. And indeed, like thanks and appreciation to the technical support, as well as the delegates to the executive committee that have also supported us in a major way in helping us through all of the resolutions and reports that we went through. And certainly kudos to our rapporteur. Very good, very tight, very dedicated work with the enormous difficulties that being a rapporteur entails. And here in Bogota, I must also express my thanks to my own technical team. It is miraculous that we haven't had a single glitch in all of this time. And we were all nervous about that, but we're very pleased that this is the case. And a special thanks to Dr. Jeannie Tambini, the head of the PAHO office here, and Ms. Paola from the Minister of Health, my own private personal assistant, Gina Tambala. And to them all, I can say heartfelt thanks. Trust me, I'll remember this. And timely photographs won't do it. We will have to remember the thrill of having lived through this first virtual directing council. And let's hope, keep our fingers crossed, say a prayer that the next time around we can meet in person and warmly embrace each other and celebrate coming together again in person. But let me end with that hortatory expression. We must have hope. COVID has hit us. We are fighting back and we will prevail. And as a region, And as a hemisphere and as members of this planet and very much integrated into our respective health systems, we are living through historic times, but by golly, we are living up to them with efficiency, with energy, with absolute determination. And I think we can say we should be proud of ourselves. And with these words, I now declare closed this 58th Directing Council of the Pan American Health Organization, and use the gavel. I'm going to give a few indications for tomorrow. The 58th Council is now closed, but for the members of the Executive Committee and of some others that are going to be with us as observers, please use the same link you had today. So thanks very much, and see you at the next Directing Council in a year.